Through this event, we will unravel the intricacies of this essential medical procedure, exploring its latest advancements, best practices, and the profound impact it has on patient care. Ladies and gentlemen, esteemed Level 4 coordinators, co-clinical instructors, and our dear Level 4 students, a pleasant morning to all. I am Selena Angeli B. Aseneta, and I welcome you all as your host for today's intravenous therapy webinar. But before we begin, I'd just like to give everyone a few reminders. First, all attendees are encouraged to turn their cameras on, and please mute all your microphones during the discussion. Second, questions will be entertained right after the speaker's discussion. So if you have any questions, you may write them on our Zoom chat box. Alternatively, you may also click the raise hand button found at the bottom of your screens. And of course, last but not the least, please listen attentively and take down notes. Okay, so I hope I made myself clear on that. And of course, before we begin, may I invite everyone to join in our morning exercise, of course, to boost your energy and keep your vibrations. Sa atong pwede matawag. Mr. Sibayan. Okay, Mr. Sibayan, what are your expectations for today? Kamusta? Kamusta ka?
Hello, Mom. I'm doing well. Sure.
You're doing well. So what do you expect for today?
Makalearn mo of different complications about sa IV, Mom, and then yun, Ma'am.
Maka-learn ng different complications sa IV. Yes, no? You will really learn about that today. So, unsa pa? Anybody? Any more? Sige daw. Girl naman, no? From the ladies. Hanap tayo. Ayan, si Miss Alonzo Cherise.
Good morning, ma'am. So I expect na ma-refresh ang aking mind about IV therapy po.
Yeah, so definitely ma-refresh yun ka about IV therapy. Okay? So ginagaranti yun na namo today. All right. So since we have already you have already performed your morning exercise, so karon i-exercise na pud nato atong mga brains. So we will be having our pre-test. No, so your pre-test will be sent through Google Forms, no, naa siya sa ato ang mga Zoom chat. To learn more about IV therapy. So as we explore and expand our horizons, we are lucky to have with us today these distinguished speakers who will guide us through a comprehensive journey, shedding light on the art and science of administering treatments intravenously. So I won't keep you waiting anymore. Let us all embark on this educational voyage and deepen our understanding of intravenous therapy. So to start with, allow me to introduce our first speaker. He is an alumnus of San Pedro College with a Bachelor of Science in Nursing degree from batch 2009. He underwent emergency room training at Southern Philippines Medical Center for 5 months and became a staff nurse at San Pedro Hospital St. Mary's Ward for 8 years. Currently, he is one of the most dynamic clinical instructors of Level 4. Ladies and gentlemen, to walk us through the history and standards of nursing practice in IV therapy, let us all welcome Mr. Raymond Manlod, RN. A virtual round of applause, please.
show reaction po kung narinig niyo po ako. Sorry, we do have some technical difficulties muna. Ayan. Diba? Di ako makita, no? Okay. Ayan. Good morning, everyone. Ayan po. Good morning, fourth year. Congratulations on your being here as a fourth year student po, Ma'am Sensors. Saan ba ang camera dito? Saan ba katingin ito? Ano? Okay. Sorry Yan. Some technical difficulties lang po talaga, Ma'am Sensors, because the clinical instructors are live here in the school while kayo naman po nandun lang po sa inyong mga bahay. Okay, technical difficulties. Sensya. Okay, so before I'm going to start with my topic po, Ma'am Sensors, I will be discussing all about yung ating history at saka yung ating legal basis, the competencies and the basis on why we do your IV therapy po. Okay, just wait lang po kasi we are having some technical difficulties lang po talaga. Diba? Galing. Okay, kumusta naman mo guys? Kumusta? Hopefully you're doing fine there. I'm just going to stretch na lang po ha. May kasi scrambling pa kami dito. Woo! Diba guys? Chill. Sino ba dito ang nakakain na po, Ma'am Senses? Sino dito nakakain na? Hands up po yung mga nakakain. Hands up. Kung naka-breakfast. Very good. Yan, thank you. Sino yung mga nakaligo na po? Nakaligo. Sharo. Oy, wala yung nag-hands up. Oh my God. Diba? Tama-tama. Pag 8 o'clock, gising agad, turn on, pasok sa Zoom, yun na po. Okay? Okay, maybe some of you are thinking, sir, mag-RD pa kami, magre-return demonstration pa kami with regards to your IV insertion. Okay, sadly guys, it's not under the scope of your student nurse. Sa ating curriculum po, ma'ams and sirs, it's not under there na dapat kayo mag-return demonstration in our IV insertion. But in your second year, third year, and fourth year, lahat po yan, ang tinuturo po sa inyo is to RN batch 2024, tama po ba? Tama no? RN 2024 kayo. Okay. Okay, ayan po. Hey, question ko po sa inyo. Sino ba dito ang naka-assist na po in IV insertion? Sige daw, hands up po. Sino yung mga naka-assist? Siyempre, mag-aas ako if ever. Sino yung naka-insert? Hindi naman po kayo pwede. Sino yung naka-assist? Yan, si Misun. Yan. So, how was the experience, Miss Sun?
Okay lang po.
Okay lang. Yan. Ano po yung mga ginawa mo when you are assisting the IV insertion po? Hi, ma'am.
Ano po, like, prepare mo yung plaster, mga sometimes ma-request more than 7, depende sa nurse gaano karami. Prepare yung 10K niya, tsaka anong gauge gamitin for the patient. Depende sa request sa doktor, at tsaka yung sa ugat sa pasyente. At tsaka after that, prepare, check doctor's order. After check sa doctor's order, prepare ang gamit, yan yung plaster, tourniquet, and yung tourniquet, tsaka yung gauge, yung gano kalaki yung, ano tawag to, yung cannula for the patient.
Kanyo na.
Then, pagpunta doon, first ask niya prepare na mo daan ang tape, tapos, mag-request man yun ang nurse is, ang tourniquet muna. After tourniquet, open na ni, tas request na yung cannula ipakuha sa imuha, then abilin niya, then sukaton, ma-observe niya, maisukaton nila muna, bago na isukaton nila ang cannula kung paano nila estimate, paano i-insert, tapos dapat once na makita anong ugat nila, after sukat nila, tapos nakita gusto nila anong ugat nila piliin na ipa-insert. Usually sa may hand man sila sa mag-insert. So like pinakababa man yung sila simula mag-insert, then dito then after na insert, dito na sa mag-request ng mga plaster. Depende sa nurse gaano karami nila ilagay. And after that, i-prepare na yung IV line, i-connect. Yun po, then alis na. Kung yung mga gamit.
Good. So, you do have the basic grasp on how to assist and also what is the procedure in your IV insertion. Okay? Very good, Miss Sun. Yan. Sino ba dito ang mga naka-regulate na Sharo? Naka-regulate, naka-change ng IV. Don't worry, I'm not going to ask you how the process. Sino lang po yung mga naka-change na ng IVF at saka naka-regulate? Sharo, sige daw. Sino dito? Meron bang wala nag-hands up? Sharo, no? Third year ninyo, you are already in your wards. Tama ba? Face-to-face na kayo. Third year. Yan. Pero hopefully, yeah, di natin talaga matanggal yung konti lang ang patient, so you don't have the opportunity to handle yung direct talaga na patient care. Pero hopefully in your fourth year rotation po, ma'ams and sirs, you will have the opportunity to really regulate at saka yung ating change IVF. Thank you for your reactions po, ma'ams and sirs, and hands up po, ma'ams and sirs. Okay? Ayan. Then under din po sa ating IV therapy po, ma'am sensors, is the removal. Okay? Yan po kasi ang ating IV therapy po. From the initiation going to the removal, ma'am sensors. Okay? Ayan. Okay na po ba tayo sa ating tech team? Okay. Wait lang po, ma'am sensors. Okay, pwede na po mag-hands down. Okay, to start with our history po, ma'am sensors, we will have an audio-visual presentation po, ma'am, since it's a short video lang po, explaining all about the history.
Liters of intravenous fluid are administered annually in the United States alone. You see, infusions are standard medical procedures. Here's a typical intensive care unit today. Assuming that an average of 5 litres of intravenous solution are administered per patient, nearly 190 million litres of intravenous fluid are administered annually in the United States alone. You see, infusions are Here's a typical intensive care unit today. Assuming that an average of 5 litres of intravenous solution are administered per patient, nearly 190 million litres of intravenous fluid are administered annually in the United States alone. You see, infusions are standard medical procedures. Yet most people are unaware of their dynamic history and development. Let's take a little trip into the past. It all began in the late Middle Ages. In 1492, Pope Innocent VIII received the first historically documented transfusion. He decided to give him an infusion of blood from 3 healthy young boys. A daring and fatal undertaking. But progress was inevitable. The first working intravenous infusion devices appeared in England in the 17th century. Back then they were made of natural materials such as pig bladders and quills, not metal and plastic like today. Richard Lower is considered the father of IV therapy. His designs and new devices for transfusions can even be found today in modern syringes, needles and IV catheters. Necessity is the mother of invention. The cholera epidemics that raged during the 19th century gave rise to significant milestones in the development of infusion solutions. Back then, Dr. William Brooke O'Shaughnessy came up with the first saline solution and succeeded in saving many lives thanks to IV infusions. Furthermore, the first warnings were issued about the dangers of air and particles in infusion solutions. James Mackintosh from Edinburgh therefore recommended filtering infusion solutions at least twice using thick leather. Gradually, increasingly thinner needles emerged, and syringes were fashioned from glass and silver or metal. The early 1960s then saw a massive introduction of plastic syringes and disposable needles to the American and European markets. And the Massachusetts General Hospital of Boston was the first to allow a nurse, Ada Plumer, to administer IV therapy. After that, it became common for nurses to perform infusions, thereby elevating their importance in the medical field. Around the 1970s and 80s, IV infusions led to a wider and, in this case, social revolution, with nursing societies setting guidelines for its practice. Today, new and improved technologies are continuing to transform therapy options. Electronic infusion devices, drop counters, alarms, as well as safety features that protect against needle stick injuries and blood exposure. After 500 years, the focus is now on the safety of infusion procedures. And this is where Paul comes in. Over the past 4 decades, Paul has been developing multi-barrier filter concepts for the ICU ward. Paul infusion filters protect patients from infusion-associated health risks such as air and large particles, bacteria, endotoxins. Revolutionary changes have taken place since the late Middle Ages, and so far there is no end in sight. And how Paul filter technologies can protect the intensive care unit patient.
So yan, don't worry. Ako na. Wait lang po. Ayan. 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 Okay. Sorry for the technical difficulties po, Ma'am Sensors. Ayan. My name is Karen Eve Merapet. Sorry. Ayan. So again, let me introduce myself. I'm Raymond Simanlod po, Ma'am Sensors. I am a fourth year clinical instructor po, Ma'am Sensors. But sa ano ko po talaga, I'm a anatomy and also second year, third year, depende na po yan kung saan ako ilalagay. But for now, I'll be handling the fourth year and the third year po, Ma'am Sensors. Okay, so for our discussion, I am tasked to discuss all about the history and also yung ating tinatawag na competencies and the basis of your IV therapy. Okay, so start tayo. Wait lang po. Ayan, nagkaroon lang ng technical difficulties lang po talaga. Okay? So, nursing standard on IV therapy was established in 1993 here in the Philippines po yan siya, Ma'am Sensors. Okay? In the video, so as you can have noticed, it is 1980s, 1970s. The standard was already passed on to the nurses. Okay, nursing responsibility na po siya during that 90s, 1970s and 1980s po, Ma'am Sensors. But here in the Philippines, it caught up lang po kasi kailangan na po daw ng nursing standard on the IV therapy. So it was established in 1993 by the ANSAP po, Ma'am Sensors. When we say ANSAP, it is the Association of the Nursing Services Administrators of the Philippines. They are the ones that have direct authority when it comes to patient care in the hospitals, because your ANSAP is made up of your head nurses, the chief nurses of different hospitals. Okay, so ANSAP board members and advisors, so they train po, Ma'am Sensors, trainers at the PGH or your Philippine General Hospital back on October 1993 po, Ma'am Sensors. Okay? And in the Philippine Act of 1991, this provides the IV injection is within the scope of nursing na po talaga. So 1991, but as you can see, it was established na po yung ating standard, nursing standard by 1993. Okay? So may catch po tayo dito when it comes to the scope of nursing when it comes to the IV injection. Okay, registered nurses should have special training po, Ma'am Sensors, before they are allowed to initiate and administer your IV medication or fluids. Okay, so it was first used in Cagayan de Oro po, Ma'am Sensors, and back in ating ano na po, Philippine Nursing Act po, Ma'am Sensors, RA 9173, it is solidified. Okay, na-solidify na po talaga the administrations of your parenteral injection is in the scope of nursing na po talaga. Okay, so Philippine Nursing Act of 2002. Back in our time po, Ma'am Sensors, 2009 graduate po ako. So basically, it is really required to have your IV therapy card po, Ma'am Sensors, certification before you are going to be allowed to enter sa ating hospital. So required po talaga siya. But for today po, Ma'am Sensors, it's not no longer required for the application, but it is given po, Ma'am Sensors, for professional development na po siya. Okay? So continuing education na po under yung ating IV therapy. Okay? Next. Wait lang ha. Ayan. So nursing standard on IV practice po, Ma'am Sensors. The PRC, the BON, or the Board of Nursing po, Ma'am Sensors, number 08 series, February 4, 1994, first edition was printed and circulated. So basically, this is the nursing standard po, Ma'am Sensors. It is already written. Okay? So there is training of trainers that will be training yung ating mga bagong mga salta or bagong mga nurses po, Ma'am Sensor, so that they will know what are guidelines and what should be done when you are going to insert and when you are going to have your IV therapy. Okay. Another revision was required to incorporate PRC-BON's protocol back in 1995. So there are lots of changes po, ma'am and sirs, kasi hindi naman po talaga pag magawa po tayo ng tinatawag na standards or guidelines po, ma'am and sirs, it is no longer needed yung mga updates. So basically, yung ating nursing standards on the IV practice po, ma'am and sirs, are continually being updated para po maging updated din po tayo when it comes to global competencies. Okay? Revisions again were made by the ANSAP Special Committee collaboration with your PRC BON. So basically, yung ating PRC are the Professional Regulatory Commission or yung ating sa RN po talaga, the license po, ma'am and sirs. While the ANSAP naman po, sila po yung mga hospital administrators. So they work hand in hand to make this nursing standard on your IV practice. So what is the philosophy of your ANSAP? Sorry. Mabilisan. So, envisions itself to be a cohesive, proactive, and professional association committed to excellence in nursing po, ma'am and sirs. So, basically, kailangan po talaga tayo ng excellence. That is our main goal po, ma'am and sirs, when it comes to nursing care. Okay? To give quality nursing care po, ma'am and sirs. May it be kahit anong procedure po, ma'am and sirs, dapat excellent quality nursing care po talaga tayo. Okay? Ayan. So it believes that safe and quality nursing care to patients is the primary responsibility of nurses. So IV therapy is already within the scope of nursing. So there is a need of guidelines. There is a need for your standard in your IV therapy. Okay? So guys, ayo kay magkakuan po, ma'am and sirs. This is just a overview lang po of the history po, ma'am and sirs, and also yung basic lang po talaga na IV therapy information will be given to you po, ma'am and sirs. Okay? Ayan. Then another one, believe na naman po tayo sa ating ANSAP. Believe that those practice IV therapy nursing are only those RNs. Take note guys, RNs. So registered nurses lang po tayo who are adequately trained and have completed the training requirements in the IV therapy training program for nurses as prescribed by ANSAP. But this, ano po natin po, ma'am and sirs, these are, ano ba tawag niyan? Yang required back in our times po, ma'am and sirs. Okay? So, hindi na po siya required when it comes to job application. Okay? So, it is already the administrators, yung hospital administrators job po, ma'am and sirs, to give IV therapy training to their nurses na po, ma'am and sirs. Unlike noon na kailangan po before you are going to apply your job, apply to become a staff nurse, kailangan po may IV therapy card ka na po or certification. Okay, ngayon po, hindi na po ganun po, ma'am and sirs. You're allowed to apply. After you apply, then the HR or the administrators will be the one to set schedules para po magkaroon kayo ng IV training certificates. Okay, ganun lang po siya. Yan. Oy, bakit ayaw? Diba? Yan. Okay. So another believes that its missions is fulfilled when all IV therapy nurses are proficient and competent in all clinical aspects of your IV therapy. Sir, bakit po pala tayo nagatalk ng IV therapy when in fact, sabi mo po, it's only the RNs that are allowed to perform the IV therapy. Okay? Kanina po sinabi ko po, you are allowed po, ma'am and sirs, to perform IV therapy. Yun lang po, it is limited po to your assisting, maintaining, monitoring, and removal. Okay? Yun lang po talaga ang ang pwedeng gawin ng ating mga student nurses po, ma'am and sirs. Okay? But the initiation and also the administration of your intravenous medications are given to the registered nurses po, ma'am and sirs. Once you have your license, then you can perform your administration and also insertion po, ma'am and sirs. If you are allowed to insert, if you are allowed, given the chance or opportunity to give IV medications po, ma'am and sirs, take it as a privilege po, ma'am and sirs. Okay? Kasi kahit na wala kayong license, they allowed. Yung mga staff nurses natin, especially sa ating mga ano ba tawag, staffing head nursing po, next SEM po, ma'am and sirs, if the staff nurses will allow you to perform that one, take it as a privilege po, ma'am and sirs. Okay? Yan. Privilege po yan siya. License pa rin po ng mga staff nurses ang nakasalalay po dyan. Okay? Nag-take risk po yung ating mga ano. Okay? Yan. So, UNSAP nursing standards on your IV practice po, ma'am and sirs. Okay. So, before we start with your nursing standard, let me read first the definition of your intravenous therapy po, ma'am and sirs. So, IV therapy or your IVT po, ma'am and sirs, is the administration of fluids and medications via, wait lang, a needle or a catheter, sometimes called your cannula, your IV cannula po, ma'am sensors, which is directly introduced into your bloodstream po, ma'am sensors. Okay? Kaya po siya hindi po pinapayagan yung mga student nurses po, ma'am sensors, because the route is quite fast po yung acting po, ma'am sensors, and you cannot withdraw if ever po magkaroon po ng discrepancies when you are going to give your IV medication po, ma'am sensors. Mabilis masyado yung ating effect at saka hindi na po natin ma-withdraw po, ma'am sensors. Okay? So there is really a high chance na magkakaroon ng mga malpractice if ever po. Okay, so the insertion of a needle or catheter or cannula into a vein based on the physician's written prescription. Take note, nandito sa ating definition yung physician's written prescription po, ma'am and sirs. So before you are going to perform your intravenous or you're going to administer or to initiate your intravenous therapy, isa sa mga pinakakailangan po, ma'am and sirs, is the physician's written prescription. Okay, doon sa ating ano, di ba? Is it an independent nursing action? Hindi po, ma'am and sirs. It is a dependent nursing action because it needs physician's written prescription. Kailangan din po kompleto yung ating doctor's order. Okay, the name of the patient, yung IV fluid, yung rate, okay, gaano katagal, dapat nandoon po yun lahat sa physician's order before we are going to carry out the order po, ma'am and sirs. Okay? Ayan. Yan. So objectives for your nursing standard po, ma'am and sirs. This will serve as a guide for nurses in providing safe, quality nursing care to patients relative to your IV therapy. Because IV therapy practice, nursing standard, nakaspecify po yan sa ating IV practice po talaga. So we are going to focus on the IV therapy. So it promotes the application of principles underlying the administration of your IV po, ma'am and sirs, and recognize the ethical legal implications of your IV therapy. Yes, there is a lot of ethical legal implications when you are going to give intravenous solutions po, ma'am and sirs. If you're going to initiate, you're going to monitor, you're going well po, ma'am and sirs. Meron pa ba ang boses ko? Marinig pa ako? Okay. Kasi na-touch ko po yung port. Sorry. Okay? So, meron pa rin po yan siya, ma'am and sirs. Kaya ang dami nating mga incidents when it comes to the wrong removal of IVF, the wrong follow-up of your IV. Meron pa rin po yan siya mga ethical legal implications po, ma'am and sirs. Okay? Mhm. Ayan. So scope of practice, role definition, the IV nurses are registered nurses committed to ensure the safety of all patients receiving IV therapy. Okay? So
RNs should be committed po, ma'am and sirs, and ensure the safety po, ma'am and sirs. Okay? It's not just basta lang para lang maka-insert po, ma'am and sirs. Hindi po yan ganun po, ma'am and sirs. We are giving intravenous solutions. We are giving intravenous therapy po, ma'am and sirs, para po for the good of our patients po, ma'am and sirs. Okay? In doing so po, ma'am and sirs, para po magkaroon sila ng uh, relief or kaya yung ating tinatawag na recuperation, o sa tawag na, basta R. Okay? Basta gumaling po yung patient natin, ayan, dapat meron din pong safety po, ma'am sensors. Okay? No added effects po dapat yung ating intravenous therapy po, ma'am sensors. Okay? So scope of practice, this would include the description of practice po, ma'am sensors. Also, yung marami to, ethical legal implications, basis of practice, clinical skills, duties and responsibilities, indications of your IV therapy, and your contraindications of your IV therapy. Okay? It's not necessarily pag mag-IV therapy tayo, IV therapy lang po, ma'am sensors. There are indications and there are contraindications in performing your IV therapy. Okay? There are sets of clinical skills to perform really yung ating IV therapy. And also, once you have already performed your IV therapy, once you have already administered, initiated, there are duties and responsibilities para po to maintain and also to effectively monitor yung ating IV therapy po, ma'am sensors. Okay? Ayan. So, isa-isahin natin tong ethico, basis, clinical, duties and responsibilities, indications, and contraindications. Okay? So, let's talk first about yung ating ethico-legal implications. Wait lang. Labas ko na lang lahat. Ayan. So, ANSAP Incorporated upholds quality nursing practice and is going to continue with the IV training guided with the following reasons po, ma'am sensors. Nursing curriculum does not provide in-depth training in the parenteral IV drug administration. Okay? So, it is not really given sa ating nursing curriculum yung ating IV therapy administration. Okay? But we can maintain, we can monitor, we can assist, and we can remove po, ma'am sensors. Pero yung administration and initiation, it is not in the scope of the nursing curriculum po, ma'am sensors. Kaya po, wala po tayong return demonstration when it comes to your IV insertion. Wala din po tayong return demonstrations when giving your IV therapy or your IV medications. Tama? 'Di ba? Ang mga RD natin, PO. 'Di ba? Ganun-ganun lang po. IM, sub-Q, yan. So walang intravenous po tayo po, ma'am sensors. Because the in-depth training po, ma'am sensors, of your parenteral IV drug administration will only be given to the registered nurses. Once you are already a registered nurse, then it should be given po yung training ng ating IV therapy po, ma'am sensors. And trust me, okay? Kung meron ka pong IV training po, ma'am sensors, may edge ka po talaga when it comes to performing your duties and responsibilities as a staff nurse. Okay? Kasi mahirap po masyado when you are already a staff nurse, then pupunta ka po sa hospital and you don't know how to perform your IV therapy. Hindi ka po marunong mag-insert, hindi ka po marunong mag-mix ng ating mga intravenous fluids or intravenous medications. Ang hirap po niyan po, ma'am sensors. Okay? So if you are already a registered nurse or graduate nurse po, ma'am sensors, try to find some trainings po, ma'am sensors, with regards to your IV therapy. It would really help po, ma'am sensors. Sir, how about ito pong ating ginagawa, sir? Pwede na po ba ito? Actually, guys, this one po, ma'am sensors, is just the basic IV therapy. So this is just an overview and the IV or the intravenous therapy po, ma'am sensors. Okay? Basic lang po ito. Okay? So lahat po ng sinasabi ko po ngayon po, ma'am sensors, it will be repeated to you when you are going to have your in-depth training po, ma'am sensors. Okay? But again, kasali po ito sa ating grade po, ma'am sensors, di ba? So makinig pa rin po tayo. Okay, so the nurse administrator has the command responsibility for the whole nursing practice in the healthcare facility po, ma'ams and sirs. So they are the ones responsible for your continuing education po, ma'ams and sirs. Lahat ng mga seminars, the trainings for your professional development, it is the nurse administrators of the hospitals responsibility po, ma'ams and sirs. Okay, dapat kasi up to date yung ating mga staff nurses. Up to date yung mga nurses doon. Kahit na po yung mga head nurses dapat updated. Mas dapat updated po sila. Okay? Ayan. Okay. So globally, the IV therapy certification is a mandatory requirement for a nurse practitioner. Okay, so intravenous training is voluntary only to those nurses who are adequately trained and have completed the training requirements that will be issued with an IV certificate of training and the IV training card po, ma'am and sirs. So the ethical legal implications, ito pong ganito po natin po, ma'am and sirs. Yes, we do have your certificate, but I think intravenous therapy card is no longer issued po, ma'am and sirs. Magbabalik na. Okay. Okay, some of the training facilities po, ma'am and sirs, they are giving yung ating mga intravenous training card po, ma'am and sirs. Back in our times, maka-back in our times, para talagang tigulang na dyan kay si sir, no? Gulang na po talaga si sir. Okay? Kasi noon po kasi, ma'am and sirs, it is exclusively given by the ANSAP. Okay? So hahanapin namin yung ANSAP office, magbibigay or magsischedule kami doon ng training po, ma'am and sirs. But for now po, ma'am and sirs, it's no longer exclusive po sa ating ANSAP po, ma'am and sirs. Okay? So it is given by different training facilities na po, ma'am and sirs. Maghahanap lang po kayo kung saang training facilities kayo magte-train when it comes to your intravenous training po, ma'am and sirs. Okay? Ayan. So this is the basic flow lang po, ma'am and sirs. When you are a novice nurse po in your IVT, and here comes the ating nursing standard for your IVT or your IV training. In the middle na circle po, ma'am and sirs, that is your IV training. So you will be introduced when it comes to the ANSAP standard of your IVT, implementation of the standards in your infusion care, the procedure, the demonstrations, the skill laboratories, yung ating return demonstrations po, ma'am and sirs, the proctorship, yung ating hinahanap na completion for your IV therapy. Okay? This will give an edge doon sa ating mga novice nurses po, ma'am and sirs. And later on, magiging certified nurses po sila that provides yung safe and quality nursing care po, ma'am and sirs. Okay? Ayan. So, ganun lang po. So, PRC BON's resolution number 38, series of 2016 or 2016. So, IV training or certificates shall not be mandatory po, ma'am and sirs. Wait lang po ha. Ilagay ko kasi yung aking para makita ko po yung sarili ko. Hindi sanay si sir, di ba? Na walang Okay? Ayan. Para makita po na ako kung naong, uy, my God. Okay, so IV training or certificates shall not be mandatory. So basically, it's 2016 po, ma'am and sirs. Sir, kailan ka po na-graduate? 2009. So under pa po ako sa mandatory noon po, ma'am and sirs. Back in the 2016 po, ma'am and sirs, IV training or certificates, ma'am and sirs, are no longer mandatory for employment or promotion po, ma'am and sirs. So if you are a newly registered nurse po, ma'am and sirs, bago ka lang po nakakuha ng license po, ma'am and sirs, you can apply for the staff nurse position po, ma'am and sirs. Okay? Hindi po yan sila nangangailangan ng IV training. Although it will give you an edge pero it's not a requirement anymore po, ma'ams and sirs. Okay? So the basic IVT has been incorporated in the curriculum by virtue of your CHED Memorandum Order number 14 series of 2009 po, ma'am and sirs. Ito na po yung ginagawa natin. The basic IVT training po, ma'am and sirs. Okay? So basic IVT, it is already mandated in the curriculum po, ma'am and sirs. Kaya po kailangan mag-a-attend po talaga tayo ng ating basic IVT. Okay? CHED memorandum na po yan siya, ma'am and sirs. Okay? Yan. So, IVT has no exclusivity po, ma'am and sirs. Noon kasi, it is purely exclusive sa ating ANSAP po, ma'am and sirs. If you are going to have your IV training on a different facilities, different po, aside from your ANSAP, it will not be recognized by the ANSAP po, ma'am and sirs. Noon yun siya. Ngayon po kasi, it is no longer exclusive sa ating ANSAP. Okay? So it is mag-a-apply na lang po yan sila doon sa ANSA po, ma'am sensors, and the different facilities can already give certificates po, ma'am sensors. Okay? So no exclusivity na po tayo. Okay? So accredited by your CVT Council for Nursing and ayan, basis of practice. Okay, the basis of practice po, ma'am sensors, it is a legal therapeutic prescription of a licensed physician. So this is the first step po talaga in your IV therapy. Okay, we will not perform your IV therapy if there is no doctor's order po, ma'am sensors. Okay, we are not supposed to insert IVF to give IV medication if there is no doctor's order. But sir, how about yung mga guidelines po natin when it comes to I know naka-IMCI na po kayo. And one of the guidelines in our IMCI is for the nurses to insert IV. Kahit na walang doctor's order, pag nandoon po sa ating IMCI guidelines, it is a guideline. So basically, meron na po tayong SOP to insert IV po, ma'am sensors. Okay? So basically, it is already a doctor's order po, ma'am sensors. Okay? So that's why pwede po tayo mag-IV therapy po, ma'am sensors pa rin. Okay? Yan. Baka kasi magtataka kayo, sir, wala naman pong IV therapy or doctor's order doon sa ating community. But there is a standard or there is a guideline po, ma'am sensors, that will say na pwede ka po, ganito po ang gawin mo. If this is the case, then you can perform that one po, ma'am sensors, because it is written under the guidelines po, ma'am sensors. But in the hospital po, ma'am sensors, it should not be done. Okay? Hindi po tayo mag-i-insert ng IV if ever wala po tayong doctor's order po, ma'am sensors. So as you can see here, doctor sheet, start IVF of plain NSS 1 liter, fast drip 200 cc, then regulate to 200 cc per hour. Okay? So basically, the solution of the IV is there po, ma'am sensors, the rate of the IVF, and also yung ating additional informations are there po, ma'am sensors. So complete order po siya, then you can perform your IV therapy po, ma'am sensors. Okay? Kahit na po yung to give only the IV medication po, ma'am sensors, kailangan kompleto din po yan. The name of the drug, the dosage po, ma'am sensors, the route, and also yung ating frequency po, ma'am sensors, or the timing po, ma'am sensors. Dapat kompleto po yon when you are going to give your IV medication. Kasi yung IV medication natin is under IV therapy. Okay? Ayan. So, another basis of practice po, ma'am sensors, thorough knowledge of your vascular system, interrelatedness of the body system with proficiency in the skill of IV therapy. Okay. First year kayo, nag-anatomy and physiology kayo, so you are already expected to know a little bit, kung maka a little bit. So dapat po talaga thorough knowledge po tayo sa ating vascular system. Okay? Hopefully po, ma'am sensors, you are ano ba tawag niyan? Meron pa rin po yung knowledge natin when it comes to your vascular system. You know how to differentiate the veins from your artery, saan yung mga location na best for your vein selection po, ma'am sensors. Dapat alam po ninyo if ever you are going to perform your basic IV therapy po, ma'am sensors. And you should also know yung interrelatedness. Kasi if you are going to give intravenous solutions or intravenous fluid po, ma'am sensors, there are really implications systematically. Okay? Sa system po yan siya. Kasi pag give nyo po ng medication, it is already given through the system po, ma'am sensors. Okay? Yan, mabilis masyado. And proficiency and skill of your IV therapy. Dapat alam nyo din po kung paano po tayo mag-i-insert ng tama po, ma'am sensors, the correct way on how to handle your IV cannula po, ma'am sensors. Okay? So another one, recognition of your holistic approach to patient care. Yes, siyempre. Because we are nurses, dapat po holistic po talaga yung approach natin po, ma'am sensors. Okay, not only focused on the problem, but all the totality of the person po, ma'am sensors. Okay, kaya po we are not really focused on the disease itself, but the response of the patient to the disease. Okay, yan. So next, collaboration with members of the healthcare team. Yes. Okay, kailangan po talaga ng collaboration po, ma'am sensors. Hindi po talaga ito pwede na inyo-inyo lang po, nurses only. Exclusive po yung IV therapy. No po, ma'am sensors. There are really a need to collaborate with the other healthcare team po, ma'am sensors. Okay? Ayan. Okay. Ayan. Okay, networking and linkages with your external environment and individual professional accountability. Yan, kasi meron tayong duties and responsibilities as nurses. We need to have this as basis of practice po, ma'am sensors. Okay, all of these po, ma'am sensors, are being considered when they made yung ating nursing standard for your IV practice po, ma'am sensors. Okay? Another basis of practice is the utilization of your nursing process. Ayan. Hindi po yan mawawala si nursing process po, ma'am sensors, yung ating ADPI. Okay? So assessment, the collection of data to arrive at a nursing diagnosis, the planning po, ma'am sensors, formulation of your nursing care plan relevant to your IV therapy. We have your implementation of the planned care nursing activities for your IV management, and also your evaluation po, ma'am sensors. Okay? So basically, hindi po talaga natin ma-do over yung ating ADPI po, ma'am sensors, because in nursing po, ma'am sensors, we are really using yung ating nursing process po, ma'am sensors. So please don't forget always yung ating nursing process, the ADPI. Sir, bakit kulang ng diagnosis? Meron na po dyan po, ma'am sensors, nursing diagnosis. After the assessment, you are going to arrive, or you're going to ano ba tawag yan? Cluster it and make a nursing diagnosis before you are going to plan your nursing care plan. Okay? Yung mga actions natin gagawin natin. Okay? Ayan. So, standard and competencies of your IV therapy. So, key points prior to initiation of your IV therapy po, ma'am sensors. Ano gani yung pinakauna? Sige nga, sino yung ano? What is the first thing you should do when you are going to initiate your IV therapy? Sige daw. Sino
Doctor's
dito?
order po, sir. Ultimate
Ayan.
result.
Okay, it's the doctor's order po, ma'am sensors. Okay, the physician's prescribed treatment po, ma'am sensors, dapat kumpleto. So, meron po dapat tayong patient's name, type and amount of solution, the flow rate po, ma'am sensors, the type, the dose, the frequency of medication, if it is a medication. If it is an IV solution, hindi na po kailangan itong dosage, frequency, and medication. Hindi na po yan siya. Okay? So, depende na po yan kung medication or IV solution yung i-give natin. And also, other procedures po, ma'am sensors, that may help in our prescribed treatment. Okay? Meron po tayong mga laboratories, meron tayong mga ano po, ma'am sensors. Because this will help yung ating giving holistic approach or holistic care sa ating patients. Okay? Doctor's order, pinakauna. Next is the patient assessment. Ayan. Okay? So after you ascertain na meron tayong doctor's order, ang next po natin is the patient assessment po, ma'am and sirs. Because we are going to assess the patient para po ma-determine natin kung anong gauge ang gagamitin natin, ano ba ang mga special considerations when you are going to insert and when you are going to give yung ating IV therapy. If ever the patient is already yung parang ano ba tawag natin yan? Kailangan ng frequent monitoring, okay? So frequent monitoring din po tayo, okay? So ganyan lang po yan siya. So patient assessment, dapat po meron tayong clinical status of the patient po, ma'am and sirs. We need to know kung ano po yung ating condition ng ating patient. If ever the patient is cooperative also, and also kung pwede pa po ba tayong mag-insert saan na posisyon po, ma'am and sirs. Okay, the patient's diagnosis, the patient's age, dominant arm. Okay, it's very important, dominant arm and the non-dominant arm. Okay, kasi isa sa mga guidelines natin when you are going to give or to insert or to initiate your IV therapy po, ma'am and sirs, if you're going to insert, kailangan sa non-dominant hand muna before you are going to perform it in a dominant hand po, ma'am and sirs. Okay? Condition of the vein or skin po, ma'am and sirs. Okay, ito, importante din po ito. Okay, back in my times, yung staff nurse pa po ako, kailangan ko po tingnan muna yung ating or to assess muna yung patient natin before I'm going to attempt the IV therapy. Okay? Kasi once makita ko po na kayang-kaya ko po insertan, yes, go na go po ako. But if ever I'm not confident enough to insert kasi wala akong makita, then I can refer it to my other uh, uh, co-worker or staff nurse po, ma'am sensors, na mas magaling pa po sa akin. Okay? Ganun po yan siya. Yan. So, cannula size, depende po yan siya kung ano pong vein, condition ng vein, at saka ano pong patient's age. Okay? The lesser the age or the extreme the age po, ma'am sensors, the smaller the gauge po yung gagamitin natin. Okay? Sa mga adults, yan, normal na po yan siya. Gauge 20, gauge 18 na po ang gagamitin natin. But for your pediatric, it should be smaller gauges po, ma'am sensors. Gauge 24, gauge 26. Okay? Kasi magko-collapse po yung mga veins natin if ever po mali po yung assessment natin. You're going to insert an IV cannula, gauge 18, to a 1-year-old patient. Edi wow. Okay? Hindi mo po talaga yan siya mapapasok po, ma'am sensors, kasi ang laki ng inyong needle. Then ang liit naman po ng mga veins ng ating baby. Okay? So assessment po talaga is the next step. Okay? Types of solution, if you are going to give non-vesicant or vesicant or yung mga malalapot or medyo highly ano ba tawag, corrosive. Corrosive ba yan? Vesicant po tawag natin dyan. Okay? And also you need to know the duration of the therapy po, ma'am sensors. Because if ever it is a long-term po, ma'am sensors, it is really advisable to have it centrally inserted po, ma'am sensors. Okay? Kasi meron tayong peripheral, meron tayong central when it comes to the IV therapy. Okay? Ayan. Next would be yung ating, 'di ba? Secure all equipments, 'di ba? IV set and equipment preparation. So all of the equipment should be checked for the expiration date po, ma'am sensors. Okay? The solutions, the medications po, ma'am sensors, even yung ating mga tubings po, ma'am sensors, kailangan i-check po natin yung expiration date. Okay? Kasi the sterility po yung tinitingnan po natin dyan po, ma'am sensors. Okay? So check for clarity. Any presence of holes on plastic covers? Intact po ba yung ating packaging? Yung ating plastic container po, ma'am sensors? Wala po bang sediments? Yung ating mga medications po, ma'am sensors? Okay? Kailangan po talaga you need to prepare your equipment po, ma'am sensors, whenever you are going to initiate your IV therapy. The next is check label against the physician's written prescription. So, di ba? If you are going to prepare your medication, meron tayong three times mag-check when it comes to ano. Okay? Check natin pagkuha. Then next is before you are going to prepare. Then after that one, before you are going to put back the medication. Tatlo po yan, titingnan po natin to counter. Okay, check po ma'am and sirs kung tama po ba talaga yung IV solution, tama po ba talaga yung ating IV medication that we are preparing. Okay? Next would be yung ating IV set and equipment preparation. Ito, optional ito if ever you have the equipment. Okay? But if you don't have the equipment, ayan, mano-mano po tayo. Di ba? Mano-mano tayo if ever. Okay, so IV set and equipment label for any medications that are added po, ma'am sensors. Ito, kailangan na kailangan, the IV label po, ma'am sensors. The date, the time, the dose, and the medication, and the amount po, ma'am sensors. And if ever you are going to insert your IV therapy or if you are going to initiate IV therapy po, ma'am sensors, kahit na po yung ating IV site, meron po dapat yan siyang date and time when it is inserted po, ma'am sensors, so that we can know kung kailan po natin siya papalitan. Okay? Ah, yan. Okay? So, functionality of your infusion pumps. Ayan, kung kailangan po natin ng infusion pumps po, ma'am sensors. Okay? Especially those medications na kailangan natin i-drip at kailangan po talaga na precise po yung ating drops po, ma'am sensors. Like for example, your cardio na mga drugs po, ma'am sensors. Your dopamine, your dobutamine, okay? Narupin, your nicardipine, kailangan po talaga yan siya ng mga infusion pumps po, ma'am sensors. Okay? Kasi kung mabilis po yan, ayan. Okay? Instead na having a desired effect, magkakaroon na noon ng undesired effect po, ma'am sensors. Okay? Next is medication. So, IV therapy nurses should have knowledge on all medication administered, including dosages, drug interaction, and possible clinical effects on the vascular system po, ma'am sensors. That is why we really, ano ba tawag niyan? Kanang ginabalik-balik na mo sa inyo ha, na dapat mag-drug study po kayo. If you are going to give medication, you should know what medication is that po, ma'am sensors. Ano yung ibibigay? Ano yung mga drug interaction? Ano yung mga contraindication, indications? Ano yung mga signs and symptoms for your side effects, adverse effects? Kailangan alam mo po yan siya, ma'am sensors. Okay? Especially if you are going to give intravenous solutions or intravenous medications. Okay? Kasi mabilis po talaga yung effect po, ma'am sensors. Konti pa lang nabigay mo, the effect is already there po, ma'am sensors. Okay? Sino ba dito ang nakatry or naka-experience ng kanang nakakita na pagbigay ng mga anxiolytic drugs? Like for example, diphenhydramine, midazolam, okay? 'Di ba? Konti pa lang po, meron pa po sa syringe yung ating midazolam, meron pa po yung diazepam sa ating syringe po, ma'am sensors, but it has already an effect on your patient. Yung patient natin nagda-drowsy na po kahit na hindi pa tapos pag-give ng ating medications. Okay? Ayan, akala ko sinabihan na ako na time na. Ayan. So, competencies po, ma'am sensors. Ayan, before you are going to perform your IV therapy, ito po. Hand washing muna, the standard po natin, standard precautions, standard po na ating operating procedures po, ma'am sensors. Always perform hand washing to deter the spread of microorganism. O, di ba? 5 agad sa return demonstration. Okay, so hand washing, assessing of your vital signs po, ma'am sensors, before and after your IV therapy or before initiating and after giving your IV medication, dapat po to assess or to monitor your patient. So assess dapat yung vital signs muna. The next will be your standard precautions po, ma'am sensors, kasi different medications, meron din po yung different precautions. Okay, so principles of your aseptic technique, yes, you are giving medication directly papunta po sa bloodstream po, ma'am and sirs. If you don't follow the aseptic technique, then you are introducing microorganism to the system of your patient. So pwede po talaga tayo magkaroon ng uh, ano ba tawag niyan? Systemic complications po, ma'am and sirs, which will be discussed by Sir Lee mamaya po, ma'am and sirs. Our systemic complications. Okay? Then medication calculation. Ito po yung mga ayaw ng mga nurses, di ba? Medication calculation, yung IV calculation, di ba? Kaya nag-nurse kasi walang math. But sad to say, meron po, ma'am and sirs, and very, very important po yung mga math natin. Although simple siya, pero wrong po na gawin mo po, patay inyong patient. Okay? So medication administration also po, ma'am and sirs. There are different methods on administering your medications po, ma'am and sirs. Okay? So dapat competent po tayo dyan. Okay? Next is the duties and responsibilities of your IV therapy. So nurses are responsible for initiating, monitoring, maintaining, and discontinuing. Yung sinabi ko po, pabalik-balik po, ma'am and sirs, student nurses are allowed to perform IV therapy but in a limited lang po, ma'am and sirs. You are not allowed to initiate and you are not allowed to administer, but you are allowed to assist, monitor, maintain, and discontinue. Okay? Ayan. So hopefully po, ma'am and sirs, you can perform all that aspect po, ma'am and sirs, na pwede ninyong gawin sa IV therapy po, ma'am and sirs. Para po, once you are already in the in-depth training po, ma'am and sirs, madali na lang po sa inyo. Kasi initiation na lang and administration yung kailangan ninyong kapain. Okay? Yan. So, ano pa to? Discontinuing the IV infusion and for client teaching. Ito, nakalimutan ko po ito. Very important din po ito po, ma'am and sirs. You need to communicate to your patients po, ma'am and sirs. Okay? Client teaching about the IV therapy, how to maintain the IV therapy. Okay? Yan. Kailangan po kasi yan siya. You need to inform them na, ma'am, mag-i-insert po tayo ng IV, ma'am. Please, wag nyo lang pong galaw-galawin yung IV site ninyo. Or kaya, 'di ba? Kaya magsayaw-sayaw naka dextrose, 'di ba? Balik na ang dugo, 'di ba? Daghan kay itang mga complications po, ma'am and sirs. Okay? And you will know all about that complications later po, ma'am and sirs. Ayan. So very important po talaga yung client teaching po, ma'am and sirs. Okay? Ayan. Di sabay ganahan, oy, naglisod kag insert. Then here comes pagbalik nyo po, nagsayaw-sayaw inyong patient na lisod, kayo insertan. Okay? Then pagbigay nyo po ng medication, dislodge. Then mag-i-insert na naman po kayo. 'Di ba? Ang hirap niyan po, ma'am sensors. So you really need to teach the patient how to take care of their own IV sites po, ma'am sensors. Para hindi naman po sila pabalik-balik ng insertion po, ma'am sensors. Kawawa naman din po sila. Okay? Yan. He or she shall perform the following procedures but is not limited to. Ayan. Okay? So, duties and responsibilities. Number 1, utilizing the nursing process po, ma'am sensors. Yung ADPI po natin po, ma'am sensors. When you are going to go to your patient, kailangan po talaga you need to assess, to perform. Kung meron man pong makita kayo ng mga problems, you need to diagnose, nursing diagnosis. Then you need to plan for your care po, ma'am sensors, and implement. And after you implement, you try to evaluate if ever effective yung ating implementation or effective yung giplan natin na mga actions po, ma'am sensors. And later on, we are going to document po, ma'am sensors, yung mga nursing procedures na ginawa natin at yung mga ano ba tawag nito? Sorry. Naguba ako train of thought. Sorry, good. Okay. Okay? Yan. Sa documentation po, ma'am sensors, kailangan po talaga yung procedure done po, ma'am sensors, and also yung effect po doon sa ating patient po, ma'am sensors. Okay? The second one would be carrying out of the physician's written prescription for your IV therapy. Okay? Next, preparing the necessary materials and observing the inaccuracies or error or unusualities which include but are not limited to the following: the expiration date of your IV solution and materials. Okay? Kaya doon sa ating basis po, ma'ams and sirs, dapat po talaga you need to perform or you need to secure all equipment needed po, ma'ams and sirs. Once you are going to secure, kailangan po working and also within the desired kuan pa talaga. Hindi pa talaga expired yung ating mga materials or yung mga medications or IV solutions po, ma'am and sirs. Okay? We need also to check for cracks of your IV bottles po, ma'am and sirs. Okay? Kasi po if ever you are going to continue with your IV therapy with cracks doon sa ating IV bottle, then there's a possibility na magkakaroon po tayo ng systemic complication or local complication doon sa ating IV sites. Okay? So presence of sediments, cloudiness, or IV solution. This is for your IV solutions po, ma'am and sirs. If it is not expired, okay, effective pa po ba yung ating IV solutions? Okay? Incompatibilities of drugs and solutions. This is very, very important po, ma'am and sirs. Okay? If you don't know if ever the drug that you are going to give is compatible with the solution of the patient, okay, you can really ask the pharmacy po, ma'am and sirs. Okay, doon po sa ating, if ever you are already a staff nurse po, ma'am and sirs, and you are going to give yung mga unfamiliar na mga medications po sa inyo, you can really ask doon sa ating mga experts, especially the pharmacy po, ma'am and sirs, if ever compatible po siya, ma'am and sirs. And if ever you are going to perform your drug studies po, ma'am and sirs, there's a possibility po or there, lain na possibility. Makikita nyo po talaga yung mga drug interactions po, ma'am and sirs. And you can determine if ever incompatible po sila. Kasi if ever incompatible po sila, then you need to initiate another IV access po, ma'am and sirs, para hindi po magkaroon ng drug interaction. Okay? Ayan. Sir IVT, bakit meron dito yung blood transfusion? Ayan. IVT po, ma'am and sirs, your IV intravenous therapy po, ma'am and sirs, includes yung ating mga blood components. Okay? Also, performing peripheral venipuncture to your patient, IV cannulation po, ma'am and sirs, it is also under your IV therapy po, ma'am and sirs. Okay? So using all types of needles, cannulas, excluding yung ating mga central lines po, ma'am and sirs. So basically, for your basic IV therapy po, ma'am and sirs, you are allowed to perform IV insertions peripherally. Okay? Kasi yung mga central lines po natin, like for example, your subclavian, your jugular, your femoral po, ma'am and sirs, kailangan na po yan ng mga special training, and some of it are exclusive to your doctors. Okay? Kasi mas delikado po yan siya. Mas malakas po or mas magkakaroon po tayo ng high possibility na magkaroon ng problem when it comes to the central lines po, ma'am and sirs. Okay? Grabe ang bleeding po niyan. Okay? Next would be administering blood and blood components as prescribed. Okay? Isa po ito sa duties and responsibilities if you are going to perform your intravenous therapy po, ma'am and sirs. Under siya sa ating IVT, yung ating blood transfusion. Okay? Yan. Next would be observing and assessing all adverse reactions related to your IV therapy and initiating necessary measures to avert reactions po, ma'am and sirs. Okay? If ever magkaroon po tayo ng problem, like for example, nagkakaroon tayo ng first na signs and symptoms of your local complications, then kailangan po natin ma-assess at ma-stop na po or to initiate necessary measures para hindi na po siya magiging systemic complication. Okay. Next would be adhering to established infection control practices. Yes, taking care and monitoring and maintaining your IV sites po, ma'am and sirs, it should be under sa ating infection control po, ma'am and sirs. Kasi high po talaga ang possibility na magkakaroon tayo ng local infection or systemic infection. Okay? Yan. Then, eight is ensuring technical capability in the use, care, maintenance, and evaluation of your IV equipment, such as your infusion pumps and your syringe pump. Okay? If you are already a staff nurse po, ma'am sensors, then meron po tayong mga product demo po niyan or tuturuan po kayo doon po sa hospital po, ma'am sensors. If you have patients po na meron pong mga infusion pump, then ask your clinical instructors on how to use the infusion pump. Pwedeng-pwede po yan siya, ma'am sensors. Okay? 9, documenting information related to your preparation, administration, and termination of all forms of IV therapy. Proper documentation is very, very important po, ma'am sensors. Okay? Yan. Then, clinical skills natin, the IV therapy nurses shall be proficient and competent in all clinical aspects of your IV therapy po, ma'am sensors. May it be initiating, administering, monitoring, maintaining, and discontinue po, ma'am sensors. Dapat clinical skills po talaga, meron po talaga, alam po talaga nila kung ano yung ginagawa po nila. Okay? So, algorithms in your IV therapy po, ma'am and sirs, if you're going to perform your IV therapy or initiate your IV therapy, ito po yung 5 R's na dapat natin malaman po, ma'am and sirs. And I know this is already discussed doon sa inyong FNE. Okay, fluid and electrolytes. Okay, for resuscitation po ba yung IV solution natin? For routine maintenance po ba? Is it for replacement of your electrolytes po, ma'am and sirs? Or kaya redistribution? Okay, kasi nag-fluid shifting tayo po, ma'am and sirs. Kailangan natin hatakin yung tubig na lumabas. That is redistribution. And lastly is to reassess po, ma'am and sirs, if ever kailangan pa po natin mag-give ng another na mga medications po, ma'am and sirs, for it to be effective yung ating IV therapy. Kasi one of the most important objectives sa ating IV therapy is to have yung quality at saka yung magkakaroon po ng cure, hindi naman cure, or ano ba tawag niyan? I'm out of words. Yung parang gumaling yung ating patient po, ma'am sensors. Okay, yun po yung main goal for your IV therapy po, ma'am sensors. Okay, the 5 R's, the resuscitation, the routine maintenance, replacement and redistribution, and reassessment. Actually, before you are going to resuscitate, before you are going to perform your routine maintenance, replacement, redistribution, you need to assess first. Okay? Pero nilagay na lang nila as reassessment po, ma'am sensors. Okay? So, indications, last na to, na topic po, ma'am sensors. For my part, the indications of your IV therapy. Okay? Ang indication po, ma'am sensors, ayan na po, yung 5 R's. Okay? To maintain hydration and to correct dehydration po, ma'am sensors, especially those who cannot tolerate yung sufficient volumes for your oral fluids and medications. It can be given po, ma'am sensors. If ever the patient cannot eat po, ma'am sensors, enteral feeding or kaya yung through mouth po, ma'am sensors, then we can give parenteral nutrition. Okay? Pwedeng-pwede po yan siya. Pero parenteral nutritions po, ma'am sensors, should not be given in a long term po, ma'am sensors. Kailangan po talaga maghanap ng other options po, ma'am sensors, when it comes to nutrition. Okay? Hindi pwede yan siya na all throughout the life of the person, parenteral nutrition lang po talaga ang ibibigay natin. Okay? Except na lang po talaga kung wala na po talaga. Okay? Next would be administration of your drugs. Like for example, your chemotherapy or other medications po, ma'am sensors, IV medications. And next is the transfusion of your blood and blood components. When we say blood components, ito na po yung mga specific. Like for example, your platelet concentrates. Yun. Okay? Yung PAC-RBC. Okay, and the contraindication po, ma'am sensors, administration of your irritant fluids or drugs through your peripheral access. Okay, if it is highly irritant po, ma'am sensors, then maybe the doctors will insert yung ating mga central lines po, ma'am sensors, para hindi naman po magkaroon ng mga local complications or systemic complications doon sa ating mga patients. Okay? Ayan. Are there any questions? Mamaya na lang siguro ang question and answers. Thank you for listening po, ma'am sensors.
Okay, so thank you so much, Sir Manlod, for that enlightening and comprehensive discussion about the historical background of IV therapy and its standards of practice. Truly, your insights have been incredibly valuable. So, any questions? Level 4, para kay Sir Raymond? Meron ba? Wala? So, if you are kanang shy type, no, you may ask through the Zoom chat box. So, pwede nyo lang isend sa amin ang inyong mga questions so that you are also, or you can be acknowledged. Or, no, you can also raise your hands na lang para you will be easily identified. So, walay questions. 5, 4, 3, 2, 1, wala gyud. Okay, sige. So, I guess that, well, explain din naman ni Sir Manlod, no, ang kanyang topic. So, kaya wala sa gyud sila pangutana. Or, basi gigutom na jud ni atong mga beshi diri. No, gutom na ba? Yeah, so before we proceed to our next topic, no, let us have our break first. So, be back at exactly 10 o'clock. Okay? Sige. Okay, so for our next speaker, he is a vibrant clinical instructor who specializes in the field of emergency room nursing. He graduated at San Pedro College in the year 2016. He is presently enrolled in a Master of Arts in Nursing program with a major in clinical management at Davao Doctors College. To talk about the local and systemic complications of IV therapy, please put your hands together for Mr. Ralph Herman Lee, RN.
Hello everyone, good morning. Okay, so can you hear me? Can I see mga heart reactions and thumbs up reactions? Ayun. Okay, thank you so much. So to continue with our webinar, I'm going to be talking about the complications of intravenous IV therapy. So, hindi lang sa not only in the relationships are complicated, but also in IV therapy. One moment, class. Okay, sorry for that. So to continue again, so we're going to be talking about the complications of our IVF intravenous therapy. So intravenous therapies complications are divided into two categories. So what is the role of the nurse in intravenous therapy? So the nurse assumed the role of intravenous therapy during the 1940s. And application of the nursing process is critical in preventing complications. And 90% of hospitalized patients receive IV fluids and medications through the IV route. So again, the complications of IV therapy are divided according to their location. So we have local and we have systemic location. So complication. So local complications are complications that are or near the insertion site or as result of mechanical failure. while systemic
Ah,
complications occur within the vascular system, or is remote from the IV
sige,
site
inform ako
and
sa
can be serious
binangahugdan na
or
kala. Pero
life-threatening.
kay may
So
kalaga
again,
pa
what
pa
is
sa
the vascular
construction, anything,
system?
may
The
bipolar,
vascular
unsa
system
man.
is made up of the vessels that carries blood and lymph fluid
Common
throughout
nails,
the
unsa pa?
body.
Unsay size?
So take a look at the picture, class. So what
Unsa
do
pa?
you
Yun
see?
lang?
So you see a patient that has
Unsa
undergone
oras kailangan nimo?
insertion of
Emergency ba
our
dili?
IV fluid. So is there anything wrong with the insertion?
1 p.m. lunchtime. Natulog pa man. Sabi
Can
sa
you
oras mo
see?
kung natulog si Shine ba?
Can anyone tell me?
Dili man, bak
Okay.
mabitin ni tabako.
So if you look at the direction of the insertion, class, the direction of insertion should be going from distal to proximal or going
No,
towards the
wala din ako
body. So
tulog.
in the
Anak ko
current
ka
picture, the
traffic.
direction
Nag-traffic
is
ako at
going
7. I only had
away
three,
from the
2 hours
body.
sleep good.
Okay. So let's talk about now your local complications.
Common nails, yun lang. Besides that, what else do you need?
So local
Common nails, unsa
complications
pa?
occur as adverse reactions or trauma to the surrounding
Common nails,
venipuncture site,
nothing
and
else?
assessing and monitoring are the key components
Nothing
to
else?
early intervention.
Sigurado ka?
So good venipuncture technique is the main
Tapos,
factor
sir, may
related to the
kasi clarify
prevention
ka
of
magsabi
most
na
local
kailangan ka na ganito,
complications
tapos wala ka pa
associated with
nagsulti.
IV therapy.
Bitin-bitin kay ka magsalita, mamanoid ko.
So some local complications are as follows. We have your hematoma, thrombosis,
Sabi ko, maanoid ko
phlebitis,
ba nasabi
infiltration,
mo kalag common news, taw na, after common
extravasation,
news, kalag
local
ihatod, hatod na sa
infection,
isa
and we
pa.
also
Yan
have
yung
your
pinakaayaw ko sa lahat.
venospasm. So let's look at them one by one, starting with our
Number 4,
hematoma.
sige, sige,
So
inform ako si
hematoma
Joven.
and ecchymosis is ecchymosis, the mouth formations resulting from the infiltration of blood into the tissues at the venipuncture site. So this is related to venipuncture technique, the use of a large bore
Estimate
or
mo gano'n
large
siya
cage
makatagal bago
cannula, which
maubos.
can cause trauma to the vein during insertion, and patients that that are receiving anticoagulants or medications that prevent the blood from clotting, and patients that are undergoing that are receiving long steroids for
Sige,
a
sige.
long term. So how does a hematoma look like? In layman's term,
Sige, sige,
hematomas
inform
are
na
what
ako si
we call
Shine.
yung
Sige,
mga
sige, sige.
pasa
Load,
or
no?
yung
At
mga
saka
buntot,
common
no?
news, no?
So maybe you've experienced this when you are having your CBC or your complete
Ay,
blood count, di ba, dito sa in the brachial area, no? So when we are
sige.
going to have our
Sige,
CBC,
sige,
if
sige.
not enough pressure is applied, no, especially for those na common
Sige,
that
inform na ako si Shine.
experiences hematoma formation.
Thank you.
Okay, so it will really cause discoloration. So hematoma is one of the most common complications of our intravenous therapy, and it can be the starting point for other complications like our thrombophlebitis and even our infection. So what are the causes, no, or what can lead to our hematoma? So these are related to the nicking or of the vein, no, or causing injury to the vein, the discontinuing of the IV without applying adequate pressure, and applying tourniquet too tightly above a previously attempted puncture site. That's why when we are doing the IV insertion, nurses avoid reinserting to a site near where there is already an attempt to start a line. Okay, again. So what are the most common causes? No, one of the most common causes is not applying enough pressure after our discontinuation of IV. That's why we always advise to apply firm pressure for at least 5 minutes in order to prevent the formation of our hematoma. So signs and symptoms of hematoma. We have the discoloration of the skin, site swelling and discomfort, or maybe even pain, inability to advance the cannula all the way through during insertion, and resistance to positive pressure during the lock flushing procedure. What does this mean? The resistance to positive pressure, meaning when you try to flush or to push fluids through the IV catheter, it is very hard. So this may be due to the formation of a hematoma. So what can we do to prevent hematoma formation? So we have to so during insertion we have to apply the tourniquet just before the venipuncture. Use a small needle in elderly patients, patients who are in steroids, or patients who have thin skin. Now, if we can, we will usually opt to use gauge 22 or even gauge 24 for patients who have sensitive veins or very prone to hematoma formation that are not requiring large bore cannulas or catheters. So other techniques that we can use to prevent hematoma, we can also use our blood pressure cuff to apply pressure, and we should always be gentle. So for treatment of hematomas, we have to apply direct light pressure for 2 to 3 minutes after the needle is removed. Have the patient elevate the extremity to promote venous return. We can apply ice for pain and discomfort, and we should always document our findings. So next complication we now have is your thrombosis. So thrombosis is a catheter-related obstruction that can be mechanical or non-thrombotic. So this is caused by trauma to the endothelial cells of the venous wall, which causes RBCs or red blood cells to adhere or to come together in the vein wall, and they form a clot or what we call our thrombosis. So this can lead to the slowing of our drip rate, or the line does not flush easily, and there is resistance when we are trying to flush. So whenever we encounter a situation when we are trying to flush the IV line, and there is hard resistance, so we should never forcefully flush it, because this might cause a thrombolytic embolism, or it may cause the thrombosis to be dislodged and be included in the circulation. So there are types of thrombosis and or occlusions. So the different types are namely persistent withdrawal occlusion, partial occlusion, complete occlusion, fibrin tail, fibrin sheath, and mural thrombosis. So here are the four types of thrombotic occlusions. So if your fibrin tail, it's called tail because it's not fully occluding the catheter, but rather it forms a elongated end which resembles a tail, while a sheath fully occludes the catheter and forms a layer near the in the opening, while a mural thrombus occludes all sides but leaves the center open, and an intraluminal thrombus means that there is thrombus formation inside the lumen or the catheter. That's why it's called intraluminal. So we also have to classify according to the degree of occlusion. So for your interluminal occlusion, we have your total occlusion, which is the probable cause is the intraluminal thrombus. So the symptom for this, or to diagnose this, we are unable now to infuse or even aspirate because it is totally occluded and preventing blood flow or the flow of the IV fluid or medication. So for your partial occlusion, this can be caused by your fibrin flap, and we are now and because of the shape of the flap, we are able to flush, but we are now unable to aspirate as the positive pressure causes the flap to occlude the catheter. So a fibrin sheath may cause backflow of our infusate to the insertion site. Infusate is what we are causing, or what we are going to be introducing to the catheter. Okay. As you can see in the picture, the red tissue surrounding the catheter is now what we call our fibrin sheath. So it causes the site to be swollen, and it prevents the proper flow of the fluids or medications inside the vein. So thrombosis are related to or are common in patients that have hypertensive, which causes that are hypertensive, which causes their blood to back up, or for patients that have ordered IV flow rates that are slow, And it also has to do with the location of the IV cannula, especially if it is in the lower extremities and the site is not properly elevated. So it may cause the backflow and the formation of our thrombus. And it can also be caused by the compression of the IV line for extended period of time, because compression can cause the flow to become restricted uh, and allow the formation of our thrombosis. And next related factor for our thrombosis is our trauma to the vein wall, which causes the adherence of our red blood cells that can lead to thrombus formation. So signs and symptoms of of your thrombosis is your fever, malaise, slowed or stopped infusion rate, and your inability to flush. So how do we prevent our thrombosis? So we can utilize, as what Sir Manlod said, the use of our infusion pumps to manage the flow rate. And if we are ordered to start a if we are ordered to start the IV therapy, and we are only using the low flow rate, such as flow rates below 50 cc per hour, so we can utilize our microset or our micro drip tubings, which allows for a high flow but only low volume in order to discourage the formation of our thrombosis. One thing we also can also Another thing that we can also do to prevent the formation of thrombosis is to avoid areas inserting in areas that allow for large degree of flexion. Why? Because these areas, when they are being flexed, can cause occlusions, which can slow down or even impede the flow of our IV therapy, thus once again leading to our formation of our thrombus. So in cases like our blood transfusion, we can also use our blood set, which contain filters to prevent the formation of our thrombus. And we avoid, as mentioned, lower extremities, as this can promote a backflow, especially for hypertensive patients, and invite the formation of thrombus. So treatment, we never flush the cannula if you're suspecting any occlusion or thrombosis. So what do we do? We just discontinue and keep the set sterile, and we notify the physician to assess the site for circulatory impairment or order for reinsertion. So that's for thrombosis. Now, next complication we now have is your phlebitis. So when we hear the word itis, what do we mean by this? It always has something to do with inflammation. So phlebitis is the same. It is the inflammation of the vein in which the endothelial cells of the venous wall become irritated and cells roughen, allowing platelets to adhere and predispose the vein to inflammation-induced phlebitis. So when patients are undergoing the phlebitis, they may complain that the area is very tender and can be very painful. So phlebitis is caused when the immune system attacks the leukocytes to causes the leukocytes to gather at the inflamed site, and the pyrogens stimulate the hypothalamus to raise our body temperature. That's why when we are experiencing a fever, we're experiencing infection, our body's natural reaction is to always have a fever. So the pyrogens now stimulate the bone marrow to release more leukocytes, and the redness and tenderness increases because of the process that is happening in the area wherein there is a immune response. So signs and symptoms, how can we identify if there is phlebitis? So the site as seen in the picture will be red. It is warm to touch. There is local swelling. The cord is palpable along the vein. There is a sluggish infusion rate. The IVF may still be flowing, but no matter how you try to increase the rate, it will still be very slow. And there is increase in basal temperature of 1 degree Celsius or even more. So how do we prevent phlebitis? So we can use our larger veins for our hypertonic ionic solutions, which causes our fluid shifting. And we can also use our centerline infusions for infusions that are lasting 5 days or longer. So if you heard of centerlines before, maybe in the medical shows, start a centerline. These are common for patients that are undergoing long-term therapy, like your oncologic patients or even sometimes patients with dialysis that are needing multiple transfusions. So we are starting a center line because they are more stable and used for the long term. So there are less chances of dislodging when we are using the center line. Right? So maybe some of you that have experienced hospitalization have also experienced some of the complications before. No? Maybe your hematoma or even our phlebitis. Okay, so we may understand that it is very painful when this occurs. No? So we have different types of phlebitis, namely your mechanical, chemical, bacterial, and your post-infusion. No? So let's start with the first type, which is your mechanical. So mechanical phlebitis is usually caused by a catheter or cannula that is too large for the size of the vein, or the manipulation of the catheter when there is improper stabilization. If you ever seen observe in your hands now, especially for those who have large veins that are easily visible, if you allow your veins to swell, no, how can you cause them to be more visible? Put your hand down, allow the blood to pool. If you can see them swell, if you flex your wrists, mine personally, if I allow my veins to swell, makita siya sa wrist. If I flex it, I can easily see my vein that is mobile, no? Ewan ko lang kung makita ba ang aking vein or ang balahibo lang makita. Okay? So I can easily see my vein when I flex that it is very mobile. No? So veins like those are not ideal for our IV therapy as they can cause complications such as your phlebitis because they are not easily stabilized. Next type of phlebitis, we now have your chemical. So the vein becomes inflamed by irritating or vesicant solutions or even our medications. No? So one example of solutions that are irritating is the medication or the IV solution itself, or improperly mixed or dilute or improperly diluted medications. It can also be caused by too rapid of an infusion rate and the presence of particular matter in the IV fluid which are not supposed to be there. No, so this can cause irritation and can lead to inflammation as these substances are not supposed to be present in the IV intravenous fluid. So to add for chemical phlebitis, the more acidic the IV solution, the greater is the risk of our chemical phlebitis. So additives such as your potassium, and we should also consider the type of material. Type of material. Okay. So for more acidic solutions, so the length of dwell, no, or how long that the solution may stay in the IV is also a huge factor. How long the solution may stay with the patient is also a huge factor to consider as again, the more acidic, the higher the risk. So it increases, the risk of phlebitis increases day by day, 30% by day 2, 39 to 40% by day 3, according to Mackey and Ringer. And also, the slower the rate of infusion, the less chances of irritation may occur. So one example of chemical phlebitis, no? One cause is what we call your uh, naficillin, because chemical phlebitis can also be caused by our medications such as your antibiotics and chemotherapy or other medications that can go inside your vein. So naficillin is an example of a antibiotic. What type of antibiotic? Specifically, it is a parenteral second generation penicillin-based antibiotic, which is used to treat moderate to severe staphylococcal infections. So this is a very potent type of medication, and if not infused properly or given properly, it can lead to our chemical phlebitis. So for our bacterial phlebitis now, which is also called our septic phlebitis, which is the least common type of phlebitis. So this is inflammation of the intima of the vein. So what can contribute, or what leads to the causes of the or occurrences of our chemical phlebitis? So poor aseptic technique. That's why, again, we mentioned every time we do a procedure, especially this type of procedure which requires us to be clean or sterile, we always, number one prevention is wash our hands. Okay, number one prevention to number one prevention to defer the spread of microorganisms is to wash our hands. Other contributing factors is failure to detect breaks in the integrity of the equipment. No, maybe ang equipment is a very old stock, so baka nasira na yung packaging, and it harbors the presence of our bacteria. Then poor insertion technique, no, wala na properly disinfect, or ang technique itself is not ideal to go in smoothly. So there is inadequate stabilization, like you said, no, it causes the blood to pool and maybe even invite the presence of our bacteria. So failure to perform site assessment, no, maybe the site has already cases of bacterial growth. Tapos pag-insert, so nag-introduce ng portal to go inside the vein. And next, we have your aseptic preparation of solutions. No? So that's why, if you notice in the IV fluids in your duty last semester, diba, there is always a seal cover. No? Do not use an IV solution that already has its seal broken without you seeing it being open, because if not prepared properly or handled properly, this can lead to the occurrences of bacterial infection or our septic phlebitis. No? And like I mentioned, hand washing and preparing the skin, contributing factors. So one best way to prevent, wash your hands. Okay, but again, this is the most least common type of phlebitis, your bacterial. So lastly, we have your post-infusion phlebitis. So what is post-infusion phlebitis? So this is an inflammation of the vein wherein the cannula is already, or the therapy is already discontinued. So what is the time frame? So it is within 48 to 96 hours after the therapy was discontinued. So factors that contribute to this complication, namely insertion technique, condition of the vein use, the type and compatibility, and the pH of the solution used. Again, higher the acidity, higher the chance of our occurrence of phlebitis. So we should also consider the gauge, the site, and the length of the material being used. Maybe nag-delay allergic reaction, or even delayed na inflammation
Siguro si may
after it was
pang-telepono,
discontinued. No?
squash.
Also, the dwell time.
Oh,
How long has
good.
the
Baka nakalimut mo ba?
has
May
the
kuan ka
catheter
ba?
been inside the vein?
Check the meron
No,
ka dyan?
infrequent dressing change for cases that there is local infection in the skin, and host factors. No? Look at the age and the presence of the disease itself. Okay. So now we're done with your post-infusion phlebitis. Let's talk about your thrombophlebitis. So thrombophlebitis is composing of two complications. So it is a twofold injury. It is a combination of your thrombosis and your phlebitis, or inflammation. Okay. So when does this commonly occur? Our thrombophlebitis. So it is commonly occurring when the patient is undergoing IV therapy in the lower extremities, and the use of our hypertonic solutions or highly acidic infusion solutions, and which causes similar to those, which cause the causes are similar to those of uh, causes of our phlebitis itself. So again, thrombophlebitis, what is the combination of complications? It's your thrombosis and your inflammation or your phlebitis. So if painful na ganit daan ng thrombosis and phlebitis itself is also painful, so kung combination, very painful na. So what are the signs and symptoms wherein we can suspect that there is thrombophlebitis? So we have your sluggish flow rate, edema in the limbs, edema where there is fluid inside of the tissues and not inside the veins. Okay. Tender and cord-like vein. The site is formed to touch. Visible red line. No, ang red line, as you can see sa picture, diba, there is a very visible red line above the venipuncture site and diminished arterial pulses. No? And in some cases, we may see cases of mottling or cyanosis of the extremities. No? Magka-discoloration na because of the occlusion caused by your thrombophlebitis. So how do we prevent over thrombophlebitis? So we use veins in the forearm rather in the hands. Do not use veins at the joint, no, or yung areas na may high degree of flexion. So assess areas, assess site every 4 hours in adults and 2 hours in children. Bakit shorter ang span na mag-reassess kung children, no? Ano palang number one problem pag ang child is undergoing intravenous therapy, no? So naka-experience na maging or to become a watcher sa hospital, especially if a child ang patient. Number one problem is they are very mobile, no? They cannot sit still. They cannot just immobilize the areas of insertion, no? They will tend to use it, and this leads to higher occurrences of our IV becoming dislodged. So that's why we have to have special consideration when we have a younger patient, no, or a child. Okay. So other ways to prevent is the securement or proper securing of our catheter or cannula and infuse at the rate prescribed and use the smallest size catheter to do the job. No? Kung pwede maliit lang, if just for insertion of medication, so we can use an appropriate size catheter. Pero what if blood transfusion? For blood transfusion si patient po. So wala talaga tayong choice. It should be the largest possible, no? Cannula or catheter. Okay, and for introduction of medication, it should be properly diluted, no, in order to prevent our thrombophlebitis. Properly dilute. No? If you watch mga videos, if you encounter mga nurse bloggers, okay, one of the most common complaints sa mga nurses, what is your favorite medication to dilute, no? 99% all nurses will say your Pipetaz or your piperacillin and tazobactam, no? Coming from the former OIC of the St. Mary's Ward, I know he can relate very well, no? Your piperacillin and tazobactam 4.5 grams, no? Correct ba sir, no? 4.5 grams, no? No, very favorite na medication sa mga nurses. You will end your shift that your hand is very, sa English siya pamaol, that your hand is very exhausted because of shaking the drug and diluting the drug. Akala, it's not just satire class. It's not just a joke sa mga videos. Reality. That's reality of this medication. Your piperacillin and tazobactam. It's very hard to dilute. Okay? So prevention naman, how do we prevent? So appropriate skin preparation, no? Again, aseptic technique, wash your hands, no? So 60% of the occurrences of thrombophlebitis or infection or inflammation comes from the patient's skin, 35% from the line itself, and 5% are from the hands, no? So lowest percent, but still the percent increases. So again, wash your hands, no? What is our motto? Prevention is always better than cure. Okay. So next complication, no, we're done with your inflammation. We're now talking about your infiltration, no. So sa mga terminologies, ito yung this is what you can hear sometimes na ginasabi na true and true, no, or na infiltrate instead of the catheter or the cannula staying inside the vein, it pierces, no, through the vein. That's why sometimes called true and true, no. But the exact term is called your infiltration. Okay? So the infiltration is the inadvertent administration of a non-vesicant solution into the surrounding tissue instead of the vein itself. No? So this can cause the swelling, no? Or yung sinasabi na nag-ubag ang kamay. Okay? So this is the dislodgement of the catheter from the vein. And this is second to phlebitis as the cause of IV therapy morbidity, our infiltration. No? Why man sir? Bakit may cause man to sa morbidity? Because it can lead to other complications, no? Such as your congestion or even it can encourage the formation of your embolism if depende asa na site na infiltrate. Hmm? So this is an example. Now the yellow outline that you can see in the picture is your catheter. The red one is your vein. So as you can see, the catheter passes from the top going straight to the bottom. No? So naglabas yung fluid in the surrounding tissue instead of being infused inside the vein. Okay. So again, infiltration is related to the distal puncture of the distal vein wall, the access, no? Bakit distal po, sir? Because need man talaga natin i-penetrate ang proximal na vein wall, no? In order to gain access to the vein. What the problem becomes is no overshoot ang catheter. Okay? Is dapat okay inside, we should follow the vein using the cannula. But instead, no, inside, push pa, nag-go outside na. Okay? So that's why distal ang complication. So the puncture of the vein wall by mechanical friction, okay? If sobra nagarab and ang vein is very sensitive, it can cause the vein wall to be punctured, and the dislodgement of the catheter from the intima of the vein, no? Or from inside the vein. Imbes na sa inside na, so wala na, eventually nag-move out. So what causes this? So cases such as your poor securement or high delivery rate or even the over manipulation, yung laging ginagalaw, no? That's why some cases, no, especially if pedia patient, what do we do in order to prevent the complications, no? We use the splint. Along with using the splint, we wrap the site using our diaper or our lampin. No? Sa English sa lampin. Wala yung makatubag. Okay. What is the English of lampin, class? Uy, mga ginikanan. Ah, face towel na lang, face towel. Okay. Na makatubag? No? What is the English of lampin? Di mo pud
Layet,
basunan.
sir.
Ano yan?
Layet.
Layets? Pwede. Hindi ko sure. Sige, search natin yan later. Baka I will try to answer that before mag-end natin yung webinar. No? Because pag nagabili kasi ng lampin sa baby store, ang tag niya kasi is reusable diaper. Hindi kasi siya tag as lampin. No? Gano'n ginastoryan ako na. Ay, so, wag niyo naman na yan problemahin, class. No? Okay, later niyo na yan problemahin. Okay? No. Pero sa mga ganyan na mabagay, no, worth it ang mga branded like yung Enfant. Okay? Because smooth good siya sa skin ng baby. Okay, so to continue, signs and symptoms of your infiltration, no? So opposite siya sa ating inflammation. If the inflammation, there is red, tender swelling. So sa ating inflammation, there is coolness around the site, no? Parang ng lamig. And the skin is taut. Or ano yung taut? Parang overly stretched, di ba? Like what you're doing in your skin testing, you are touting the skin, no, para ma-stretch. So ganun ang nangyari sa infiltration. Why? Sir, why man overstretch yung skin? Because of the fluid accumulation in the surrounding tissue instead of the vein itself. No? So it causes swelling. So there is also what we call your dependent edema, no? The absence of blood return, and if there is blood return, it is pinkish instead of the dark red, no, na blood na known to be coming out of the veins, and the infusion rate also slows. Right? No, so severe cases. Here are some examples. No, here are some examples of your infiltration. Ito yung mga severe cases. Okay. So the complication of your infiltration falls into three categories. No. So ulceration, we have your compartment syndrome, and your reflex sympathetic dystrophy syndrome. Okay? So our ulceration and possible tissue necrosis is tissue death, diba? This may be due to the occlusion. Your compartment syndrome, no, in your ortho before, diba? Third year, yung third year kayo, in your ortho, no? Hindi lang ito siya caused by the cast, but also could be caused by any form of obstruction, which causes the area to be compartmentalized from the rest of the body. That's why compartment syndrome, hindi siya casting syndrome. Okay? And your dystrophy syndrome because of the inability to move. So it can cause dystrophy, no? Or mag-wasting yung muscles. Okay? So again, so our RSD or our reflex sympathetic dystrophy is a condition that features a group of typical symptoms including pain. What type of pain? Yung burning, no? Tenderness and swelling of an extremity, okay, associated with sweating, warm, coolness, flushing, and discoloration of our shiny skin. No, that's so side by side, no? Parang yung may hand na may ring, very pinkish, no? Ang color. While yung hand na ginapoint ng arrow, yung may RSD or may reflex sympathetic dystrophy, it looks flush, no? Or parang nagluspad compared to the other hand, no? Baka nakita ka, sir, bakit yan sa may picture sa bata, sir? No, yan naka-intubate. So, common practice kasi before class na if hindi makakita ng veins sa extremities, no? So yung veins sa head ng mga pedia patient ginagamit para maka-insert ng line, no? So, mag-fall pa rin siya na may complication, especially in cases of your infiltration. Right? So, let's have another example, no? So, what's wrong with this picture, class? What can you see? No? What's wrong? Everything is wrong? Okay? So, in this case, class, no? This is an example of your extravasation. Okay? So what is extravasation? It's not just infiltration itself, but extravasation is an inadvertent administration of a specific type of solution into surrounding tissue. What type of solution? That's your vesicant solution or vesicant fluid. No? So what is your vesicant fluid? It is a fluid or medication that causes the formation of your blisters or subsequent slowing of the tissues occurring from tissue necrosis. No? Tissue necrosis. So, ano ba yung slowing, sir? No, subsequent going to or going from papunta. No? Occurring from tissue necrosis para mag-gather or to adhere. Okay? Sabi, sir. So, what is the difference, no, of your vesicants? Okay? Or what are examples of your vesicants? So, ito sila. No? Ay, first pala. Extravasations are related to the following causes, such as your puncture of the distal wall, mechanical friction, and the dislodgement of the catheter. So same lang sa infiltration. No? Ang different lang talaga sa extravasation is the fluid or the solution that is being introduced, which are your vesicants. So what is an example of vesicants? You have your Phenergan, which is very acidic with a pH of 4 to 5.5. You also have your dilantin. We have your high concentration of your KCl or your potassium chloride, your calcium gluconate, your amphotericin B, which has a pH of 5.7 to 8, your dopamine, nipride. We have your dextrose containing 10, 20, or 50%, and your sodium bicarb. No? Your sodium bicarbonate. So these are some example of your vesicant. No? So these are different types of medication. No? Maybe you heard of some not. No? So these are just one of the most common. No? So in the areas, no? So kung sa ward lang na patient or even ICU patients, we can encounter cases with your sodium bicarb or your potassium chloride na makita natin na magkaroon ng extravasation. Okay? So signs and symptoms, no? Signs and symptoms, so burning pain, okay, swelling of the proximal to distal areas of the IV site, puffiness of the dependent part of the limb, skin tightness as the vein at the vein puncture site, blanching and coolness of the skin, and slow or stop infusion, damp or wet dressing uh, or damp or wet anchors to the IV cannula. No? Yung mga example, di ba, common sa atin, plaster. No? So, baka naging damp na siya or na wet. Bakit? Because nag-leak na yung vesicants, no? Outside of the insertion site. Okay? So, how to prevent? No? How to prevent? So, cases na sensitive ang vein, no? So, dito lalabas yung mga ginatawag natin ng mga shooters, no? Or yung mga skilled practitioners. Yung mga nurses na nag-specialize in insertion of difficult veins, no? You should also have a good knowledge of the vesicants, no? Or the solution that you are about to introduce, no? So, maybe high risk ito siya for extravasation. So need mo siya i-properly dilute or to administer slowly, no? If applicable, we can also utilize our syringe pump in order to administer it slowly. Okay? So we should also check the condition of the patient's vein, no? Baka need mag-double line, yung one line exclusive for the use of our medication. Okay? And our drug admission technique. No? So if continuous, give our CVAD. So if only risk with brisk blood return of 3 to 5 cc. And use a free flow IV. Okay? So these are some extreme examples, class, no, of your extravasations. No? So na dead, grabe na talaga ka dead ang skin. Okay? So extravasations caused by different agents. Ito siya sa Finnegan, no? Interarterial. So sa distal area nangyari yun, no? Yung kayong fingers. This one is caused by the dilantin, no? Or phenytoin. So like I mentioned earlier, no? What is the difference between our infiltration and extravasation? Okay, so infiltration is the leakage of non-vesicant fluids into the surrounding tissue, while our extravasation is the leakage of our vesicant solution into the surrounding tissue. No? So the mechanism itself is the same class, no? Naga through and through, the catheter is introducing fluid outside of the vein and into the surrounding tissue. So mag-categorize na lang tayo according to what type of fluid is being introduced into that surrounding tissue, whether it is vesicant or non-vesicant. Okay? So kung non-vesicant, infiltration. Kung vesicant, extravasation. All right. So next complication, we have your local infection. No? So infection, ano yung maisip natin? So there is presence of microbials, no? Or there is presence of contaminants in the cannula or infusate. No? So signs and symptoms of infection, redness and swelling at the site. So possible exudates of purulent material, no? Or yung may pus, and increased quantity of white blood cells and elevated body temperature. Now, because as mentioned, if there is signs of infection, the body's natural reaction is to increase temperature. Okay, so one example, no? Kita nyo sa picture ang infection sa local IV site. Okay, so how do we document? So assessment of the site and culture technique and sources of culture, then physician notification and treatment, any treatment initiated, no? So, any treatment may even discontinuing the site, warm compress ba, or start loading those of your antibiotic, no? So, we should always document, okay? So, for the last one of your local complication, we have your, sorry, venous spasms, no? So last ito sa local. So venous spasm. And when we hear spasm, sudden voluntary contraction of a vein or an artery resulting in temporary cessation of blood flow to the vein. Bakit man mag-stop ang blood flow, sir? It's because of the contraction of the vein, no? So signs and symptoms, no? Parang biglang magreklamo. There is a sharp pain at the IV site that travels up the arm, which is caused by acute flow of fluid that irritates the vein wall. thus slowing or even stopping the infusion. So when this occurs, no, nag-stop, then you can see that the veins are constricting. No? So we should also document the complaints of the client, the duration, the treatment done, if any, and the length of time to resolve the problem. No? So makita nyo sa vein ultrasound, no, na nag-spasm talaga, nagliit talaga yung vein niya, no, because of the spasm. So ang catheter, walang magawa. No? It's either pwede siya ma-dislodge or ma-occlude yung kanyang flow. Right? So last topic for my part, we have the systematic complications. No, konti lang man ito sila. Systemic rather, systemic complications. No, so we have your septicemia, fluid overload and pulmonary edema. You have your air embolism, speed shock, and catheter embolism. No. So different sila, no? When we're talking about again systemic versus local. So the local is near or at the IV site. So systemic is located, are complications located throughout the vascular system. So let's start with septicemia. So septicemia, a febrile disease process that results from the presence of microorganisms or their toxic products in the circulatory system or vascular system. Okay, so septicemia pa lang. A good understanding na tayo, no? It has something to do with our sepsis. Okay, so signs and symptoms, you have your fluctuating fever, tremors, little cold sweats, nausea, vomiting, diarrhea, abdominal pain, tachycardia, and increased respirations or hyperventilations and altered mental status and hypotension. Okay, so when there is septicemia, so we should notify the physician immediately and do symptomatic care. What do we mean by symptomatic care? So same lang sa palliative care, we treat the symptoms that are presenting, no? And we also identify the other sources of infection. Maybe need na natin mag-perform ng ginatawag na BTN or bottle to needle. No, baka ang source of infection is coming from the IV site. No, so need na i-remove. So that's why remove your IV device, culture the IV cannula tubing or solution if suspect na doon, return fluid to pharmacy, and establish a new line for medication and fluid administration. So we also document the signs and symptoms assessed, the physician notification, and all treatments na instituted. Okay, that's for your septicemia. Next, your fluid overload and pulmonary edema. So this is caused by overload man, no? So this is caused by excessive or overload amounts of fluids. No? So pwede isotonic or hypertonic crystalloid solutions too rapidly. No? Not giving the body enough time to absorb them properly. So this can occur in cases na fail na monitor ang IV infusion or too rapid infusion of any fluid in patients compromised cardiopulmonary or even the patients that have problem with their renal system or undergo renal disease, no, such as your ESRD, okay, or end-stage renal disease. Okay, so for signs and symptoms of your fluid overload and edema, we have your restlessness, headache, tachycardia, weight gain over a short period of time, cough, and presence of edema. So this can also lead to your hypertension. So wide variance between intake and output, no? So masyadong mataas ang intake but very little ang output. And the edema itself can lead to your distended neck veins. Okay? So what do we document? The client assessment, the notification of physician, the treatment instituted by physician order. Okay? So next, no, we have your air embolism. Okay, air embolism. So air embolism is a complication wherein air is entering the central vein, which is quickly trapped in the blood as it flows forward. No? So what is the number one goal in air embolism? The number one goal is to prevent the occurrence of air embolism. No? Because this can be fatal as ang air embolism. So the patient may complain of palpitations or weakness. No, some can even complain of shortness of breath. Okay, no, if the air embolism is located in the pulmonary system, No? So patient can complain of difficulty breathing, cyanosis, tachypnea, expiratory wheezes, cough, and even your pulmonary edema. Next, yeah. So signs and symptoms naman for your cardiovascular findings. No, for cardiovascular findings, the heart may now have a murmur. No, we can also exhibit a weak and steady pulse, tachycardia, substernal chest pain, hypotension, and jugular venous distension. No? So for neurologic findings, no, kung papunta sa brain yung air embolism, there may be a rapid change in our mental status, sudden onset of confusion, anxiousness, and seizures. So what do we do if we are suspecting air embolism? So nursing intervention, immediately clamp the tubing to prevent the flowing of the air embolism throughout the body. Turn the client to left or head down to allow air to enter the right atrium and disperse via the pulmonary artery. So we should also closely monitor the vital signs, administer O2 as needed, and notify physician and document your actions. So ano na actions ang gina-document? Your assessment, okay, your assessment, nursing intervention, physician notification, and treatment. Right? Yeah. So for your speed shock naman, no? Speed shock. So mabilisan lang, 'di ba kay Speedman. So this occurs when a foreign substance, usually medication, is rapidly introduced into the circulation, no? So foreign substance, so something that should not be there na nadaan tapos bigla na lang gi-introduce at a rapid rate, no? So hindi makakompensate si body in time. So paano malaman pag nag-speed shock? So when you introduce the new foreign substance, patient may immediately complain of your dizziness, flushing, headache, tightness in the chest, hypotension, irregular pulse, and progression going into shock itself. No? So when we are suspecting speed shock, we should document the medication administered and the rate at which it was administered in. And we should look for the signs and symptoms the patient reported, and notify the physician, and treatment initiated, and whether the client complained of or expressed any alleviation. And the last systemic complication is your catheter embolism. No? So from the name itself, there is an embolism caused by the breaking of the catheter, or a piece of the catheter breaks off and travels through the vascular systems. No? So the patient may complain of sharp sudden pain at the IV site. There is now minimal blood return. There is rough uneven catheter noted on removal, and there is cyanosis, chest pain, tachycardia, and hypotension. Okay. So how do we prevent this? No, so cause man ang catheter embolism, it's caused by the catheter. So we remove the catheter, and to prevent hematoma, anong common ginagawa gani? We apply pressure, no? Consistent pressure for 2 to 3 minutes. Right? All right. So that's it for your complications. Okay? So hopefully, pag kayo naman mag-insert, hindi siya magiging complicated. All right? Okay. Question. Mm-mm. Yeah,
Okay,
questions.
so thank you so much, Sir Ralph, for shedding light on the diverse spectrum of complications related to IV therapy. We certainly learned so much. Okay, so virtual round of applause po oy para kay Sir Ralph. Yes. Isa pa lang. Asan ang uban? Ayun. Okay, so any questions? May mga questions ba kayo for... Okay, questions. Na mga questions about the discussion of Sir Ralph Lee. Wala? Sige, kung wala mo'y questions, ako'y mangutana. Walay questions. Sure gid na. O sige, kay walay questions, ako'y mangutana. O sige, sige, mangutana to direbe. Oh, naka-on cam ang all. Very good kaayo. Sige. Pizza diri. Naka-on cam gid sila tanan oh. Mahadlok mapangutan-an. Sige daw, wait lang be. Mangita gid ko. Ay, perfect. Naka-on cam ang tanan. Sige, kay naka-on cam ang tanan. Random na lang jud ko mamilihan. Sige, so tingnan natin kung sino ang hindi. Yan, isa ang naminaw og tarong sa ato ang discussion. Alright, so kay student na ni siya sa una. Asa na to siya? Sige. Kani si Mr. Boyser. Asa si Mr. Boyser?
Here po, ma'am.
Alright, sige. Mr. Boyser, give at least 3 examples of a local complication of IV therapy. O, daghan kayo to give mention si Sir Ralph. So, give at least 3.
Air embolism po.
Ano yon? Sige, 3 complications of local complications. We have, ano yon, Mr. Boyser?
Air embolism,
Air embolism. Unsa pa?
thrombosis,
Local complication, Mr. Boyser. Systemic yung air.
ay
Ano
okay.
yung sa local na ano?
Venospasm
Okay, venous spasm.
and infiltration,
Filtration, yes. Ano pa? Ano pa? Venous spasm, sa local ba ang venous spasm? Yes. And sinabi niya local spasm, venous spasm, infiltration, and one more?
extravasation.
Extravasation. Yes, correct. Okay, so let's have, for the systemic naman, sino makabigay? At least tatlong examples. Yes, Miss Sardoncillo. Ay, Mr. Sorry. Mr.
Hello po,
Sardoncillo.
ma'am. Good morning po, ma'am. For the systemic complication po, ma'am, we
At
have
least tatlo lang.
air embolism, speed shock,
Yes.
and air embolism po, ma'am.
Ano yun? Sorry, hindi ko marinig. Ano yung isa?
Air embolism, speed
Air
shock,
embolism, speed shock,
and catheter embolism po, ma'am.
catheter embolism. Yes, correct. Thank you so much. Naminaw gidaig sila. Okay, sige. So, thank you so much no sa mga nag-answers. Nag-answers yun. Sa mga nag-answer. Wait lang ha. Okay, sige. So now let us move on to our final speaker. Ready na ba? So happy na ang tanan no kasi final. So last speaker na ni siya. Okay, so our third speaker is undeniably a multi-skilled individual who successfully completed her Bachelor of Science in Nursing degree at Western Mindanao State University. She possesses professional expertise across various ICU settings and the emergency room. To give us a glimpse on how IV insertion is done, please help me welcome to our virtual stage one of the most admired clinical instructors of Level 4, Mrs. Amy Agohetas, RN. A virtual round of applause, please.
Hi, audible. Yeah. Good morning, guys. Okay. Hello, good morning. Minaw mo, marinig ako?
Marinig po, ma'am, pero mahina talaga po.
Okay,
Ma'am,
can you
mahina po.
mahina, wait. Hello? Alam ko you are bombarded with a different peaks late kanina, okay? You are bombarded with the history and the legal basis ng ating IV. And of course, you are also bombarded with the different complications that IV therapy, okay, na meron, na makikita natin with ating mga patients. So, that means, okay lang, hindi lang siya yung tipong standard operating procedures lang natin to a patient who will be admitted sa hospital to start an IV line lang. Okay? So, hindi ibig sabihin, okay, pwede lang yan, same lang yan sila with NGT and mga Foley bag catheters. Okay? Okay, pwede lang nating tusukan ang patient, okay, or anyone, okay, lagyan natin ng IV for that matter, okay. But okay, what we are trying to tell you that it has legal basis, okay, and there are complications, okay, kung magkamali man tayo when we start an IV with ating mga patient. So we're done again. We're done with ating mga legal basis, legal procedures, legal matters, okay, the deals with the IV. We are also done with the complications. So alam nyo, very um, we are very in particular with the intravenous therapy because this may also cause death sa ating mga patient. 'Di ba nga, accordingly nga, 'di ba, sa mga books, ang daming tinuturo na mga ways on how to save a patient. But there are also, okay, ways na hindi tinuturo sa book kung paano patayin ang mga patient natin. And one of which, if we are not cautious with our actions with the intravenous therapy, then definitely they will really be killing people. Okay? They will be really killing our patients also. So to start with, mag-go muna ako with the basics of ating intravenous procedures before I'll go with a video, okay, procedure. So later on, I'll be showing you, okay, actually I'll be having a patient later on and magtutusok talaga tayo ng patient, okay, to show you, okay, how it is done, okay. All those, although I know, okay, a lot of you, okay, are very eager to insert an IV, okay, parang ano na lang, sa kapatid na lang, ba? O sa mga boyfriend, sa mga uyab na nananakit, okay? So, gamitan natin ng mga gauge 18 na needle, okay, 'di ba? But okay, at your own risk na lang 'yan. Okay, at your own risk. But for the meantime, try not to do munang any insertion to any patient, okay? Kasi you still need your training, you still need your license also to insert an IV line. Okay? So hindi lang yan pwedeng, uy, si kapitbahay nagde-dehydrate. I want to insert an IV line sa aking kapitbahay kasi student nurse ako. No, it's not. Okay? It still entails your license. Okay? It still entails that you are a licensed nurse before you try to insert an IV line to any patient. Okay? Outside the hospital premises. Okay? So, wait ha. Hindi siya nagne-next. Okay. So we have here the different types of confusion. And I bet you know this one because ang pinapakita ko ngayon na slides, these are also the content ng aking fluid and electrolytes. So I am very aware that you already know about this thing. So this is just in passing na lang, okay? And try to review also with the basics ng ating intravenous therapy. Of course, for type of infusions, we have our continuous, intermittent, bolus, and piggyback. So later on, I'll be showing you a continuous infusion only. Hindi na tayo mag-intermittent kasi remember, ano mga example ng mga intermittent infusion natin? Those medications that requires a particular period of time. Okay, pwedeng every 8 hours, pwedeng every 12 hours, pwedeng once a day. So these are what we term as intermittent infusion. They seem like to be in continuous infusion pa din, pero intermittent lang. Hindi all the time naka-open ang ating line ng IV natin. So of course, when we talk about bolus, ano mga sample bolus na binibigyan natin? Like giving of bolus furosemide, okay? Giving of flushing, example ng mga NSS. Okay, ibig sabihin mabilis ang pagbigay ng gamot, okay? Common din also, anong common with the ER concept natin, ang epinephrine, 'di ba? We have to give epinephrine in a bolus infusion, type of infusion because we required an immediate action ng epinephrine sa katawan ng patient, okay? So that, okay, pumitik, magbibit ulit ang heart ng ating patients. And of course, we do not go away with the piggyback or the secondary infusion. Parang same lang siya with intermittent infusion. You should remember that, okay? The difference is continuous lang siya. Unlike kay intermittent infusion, hindi continuous ang flow ng kanyang IV. Okay? So another very good example ng ating piggyback or ng ating secondary infusions are mga vasopressors, okay? Or ang ating mga blood, okay? Blood transfusions also. So, wait. So we have here again, sige nga, let's try to identify ano itong first picture natin. Alam niyo na to, kita niyo na to sa fluid na lectures natin. Anong type of infusion ang first picture natin? This one. May nakikita ba? This one. Anyone? Sino? Gusto talaga nila tong tawagan ba? Hello? Ano tong type of infusion ng first picture natin, guys? Oops. Hello? Naririnig ako?
Continuous.
Continuous. Sino nagsasalita? Sorry. Hindi ko makita. Let me call, be. Si Miss Talita, andyan ba? Ay, na lang. Si Pat. Si Miss Olea, saan na?
Continuous po, ma'am.
Continuous. Okay. Ang second. Andyan ba si Natia? Andyan ba si Hans? Ang daming nag-out.
Secondary po, ma'am.
Okay, thank you, Hans. Secondary infusion. And of course, the third picture. Ano ang tawag natin dyan sa third picture natin? Lahat na? What do you call that one? Okay, the bolus, the giving of medication, okay, in the most fastest way that we can give, okay. So another one, we have the methods of infusion also. Thank you for your participation, guys. So methods of infusion, of course, we include ang ating gravity drip and ang ating electronic control devices. So when we talk about electronic control devices, these are the infusion pump, okay. Unluckily for us, we do not have some infusion pump in here sa ating funda, so we will have to work with ating gravity drip. Of course. Except lang, okay, the advantage lang of having mga infusion pumps is that, okay, it makes our life easier, nurses. Do you still remember your nursing informatics on how they can help us with controlling drip rate, such as drip rate na nasa 2 drops per minute lang, diba? Or 1 drop per minute. So, mahirap yan gawin, mahirap yan manually, okay, regulate, but we still have mga electronic control devices or mga infusion pump that could help us with regulating yung mga maliliit na drop rate natin. Okay? So, yan. Sorry, yeah. So we have the factors here affecting ang ating IV rates, okay? So first of all, we have the change in catheter position. Ito yung nakikita nyo ngani sa mga nurses natin. They're trying to move the hands of our patient. They're trying to put cotton, okay, cotton balls sa mga line ng patient natin para lang tumulo ang mga IV natin, okay? Ito na yung mga reasons why do we need to do that, okay? So we also have the height of the solution. What is the ideal height of the solution that we need, okay? So ideally, dapat nasa 3 feet or dapat nasa 18 to 24 inches ang level ng fluid dyan sa vein mo. So, pwedeng, okay, kaya ito nakikita natin, di ba, pag nagsi-CR ang mga patient, what will happen, okay, puro backflow. Ibig sabihin, umaakyat yung dugo sa tubing ng patient because, okay, ang ginagawa nila, okay, mababa ang height ng solution sa, it's either sa patient's heart or either sa vein, level ng veins natin. Okay? So, it's very important na mataas ang ating IV bag compare sa IV site natin. Hindi pa din sa taas ang IV site, sa baba ang fluid bag. Okay, o yung fluids natin. Hindi pa din ganyan. Okay? Anong mangyayari? Punong-puno ng dugo ang set niyan. So, we have to increase that one, okay, para hindi sige backflow ang veins ng patient. Although, it's okay. It's a good indication that patent pa ang line mo. Yun lang. Kung nag-clot na yung dugo doon, hindi na makaka-flow ng maayos yung IVs natin, mga IVs natin. Of course, the third one is the patency of the catheter. Ideally, we really have to do the checking of patency by trying to open the line. Okay, o paminsan, di ba? Ito yung nakikita natin na paminsan naririnig nyo yung humihingi tayo ng syringes sa station because we will be checking into the patency of the catheter. We will try to do the flashing. Okay? So, sa Amerika, sa aming lugar, just talaga, no? Sa America, they have this what we call yung mga pre-filled na mga normal saline for flashing. Okay? So, gagamitin mo lang yon. If flash mo yun sa patient natin, usually nasa 3 to 5 ml lang yun siya to see, okay, if patent ang line. So, if it is obstructing, hindi flowing ang pagbigay natin ng IV push, then that means out na ang line natin. We cannot readily push it harder kasi baka it may clot, okay, dyan sa veins ng patient natin. That might cause also, okay, pwedeng mga embolism also, o thromboembolism na katulad ng pinag-usapan ninyo kanina sa complications, okay? So, another method that we use is what we call as the push-pause method. We term that as push-pause method. Ibig sabihin, magpupush tayo ng 5 ml na solution sa patient natin, sa IV line ng patient natin. Then we pause. We'll try to see if tumutulo na ba yung yung IV natin. Okay, if not, we'll try again to push. If hindi pa din tumutulo, that's the time we call it na out na ang veins natin. Okay, so that means we will be discontinuing, we'll be removing the IV site, then we have to change another site for that one. Okay, pero hanggang nakapush ka, nag-pause ka, tumulo, that's good. Okay, so ideally, dapat every 30 minutes mo tinitingnan ang IV site ng patient to ensure that there will be no infiltration. But, okay, sa dami-dami ba ng patient natin, the most na lang that we can encourage them to do, or we can encourage you nurses to do, future nurses, at least you have to check the IV site of the patient every 4 hours. Okay, so kung every 4 hours, if you will be having our 8 hours duty, in as much, at least twice tingnan mo, okay, tingnan mo ang IV site ng patient natin kung tumutulo na pa ba or infiltrated na pala yung site ng patient natin. Okay? So we have also mga IVF classifications. Of course, ang daming IVF classifications, guys. Okay? We can make it through, classify that through crystalloids and colloids. Pwede din ganun. Pwede din through the tonicity. Usually, do you remember the hypertonic, hypotonic, isotonic solution? We can classify also with them. Of course, we also have according to purpose. Okay? Pwedeng through hydrations lang ba yan? For people na dehydrated. Okay? Maintenance lang ba yan? Daanan lang ng gamot? Or for pang-nutrition lang sa mga patients natin? Or even as volume as expander. Okay? So, may mga purpose din tayong ganyan. So, of course, our intravenous access, we have two intravenous access. Of course, we have the peripheral and the central veins. So, we do not do peripheral veins kasi that entails another equipment, okay, and another skills ang pinag-uusapan dyan when we do peripheral veins. Okay, so again, peripheral, ito yung mga two, intrajugular, intraosseous, okay. If you're watching mga I think si Kim Sabu sa Dr. Romantic, there was one time they do an intraosseous kasi wala silang nahanap na veins. Okay? So if you're watching Dr. Romantic, yun, ma-appreciate mo yung mga ganyang klaseng scenario. So, this is intraosseous na sinasabi ni na ma'am. Okay? So, hindi yung basta-basta nurses ang mag-i-insert niyan. Okay? It entails training. It entails an um, months of practices to do that. Okay? Para magawa mo yung mga peripheral veins insertion natin. But for the level ng mga nurses, nasa central veins lang tayo, guys. Okay? Eto din we do not use cannula. Pagdating na doon sa IJ, hindi naman yung mga cannula, IV cannula na ginagamit natin, okay? Hindi yun ang ginagamit natin sa interjugular. So they have a separate instrument, separate equipment for that. Okay. Then we have, of course, central vein, peripheral veins. We start na. Okay, how do we administer our intravenous therapy? Of course, 'di ba, sabi nga kanina ni Sir Manlod, we cannot start the IV line if there is no physician order. So, if you receive a physician order, that is the only time that you will be inserting an IV line to your patient. So we have to take into consideration what are the things that we need to check into the physician's order when we start an IV line. Of course, hindi mawawala yung sasabihin ni doc na start an IV line. Okay? So you really have to be particular with that one. Bakit? Because there are orders, okay, that are telling you to start an IV line, pero ang dulo pala nun, once on NPO or before an OR. Okay, 1 hour before OR. So we also really need to really need to read the entirety of the physician's order. Kasi pag nakita mo lang doon, start plain NSS 1 liter at 120 cc per hour, hindi mo nakita na may kasunod pa pala yun once on NPO or 1 hour before OR or 1 hour with available blood. Okay? So mga ganyan. So we also need to take into consideration with that one. Hindi lang porket nabasa mo ang, may plain NSS 1 liter, start na tayo. This is it. Okay? No, it's not. Okay? Then also, we have to see into if there are possible medications ba na gustong ipasimula ni doc? Okay, pwedeng mga KCl, potassium chloride, magnesium sulfate. Okay, we also have to read with that one. So you really have to focus on reading. Okay, reading yung the entirety of the doctor's order. Of course, ang rate of infusion, anong klaseng IV ang gagamitin, ilan ang amount of IV na gagamitin natin. Was it 1 liter ba yan? Nasa 500 lang ba yan? O nasa 250 lang ba yan? Okay? So we will also be checking that also sa ating physician's order. Okay. Now, we will of course, sa lahat ng mga procedures natin, don't forget the 5 moments of hand washing in every procedures na gagawin natin, particularly mga equipments that we will be, okay, utilizing with the patient. We really need to wash hands to deter the spread of to deter the spread of microorganism. Of course, we gather first our equipment. Later on, I'll be showing you the equipment that we will be using. Then, of course, we have to assess the patient. Okay. Eto guys, ang ka-funny pa minsan, lalo na sa aming mga ER nurses, okay, or with us nurses who will be trying to insert an IV line to the patient. Pagdating pa lang ng patient, ina-assess na namin yan ng veins. Okay, tinitingnan na namin, oh, eto, maganda ang veins. Okay na yan. Madali lang yan ang insertion mamaya. But, okay, there are cases talaga na, oh my God, ibig sabihin, we need a thorough assessment of the veins of the patient. Then we really need to take time, okay? We really need to take time to see if maganda ba ang veins ng patient natin. Okay? Then of course, when we talk about preparing the patient natin, okay, this also entails that we have to talk to the patient. We have to tell them that we will be inserting an IV line. Okay? One particular technique, okay, that we use, okay, we do not tell the patient that it's not masakit. Okay, di ba? Okay, we do not sabi mo, di ba, nagbibigay kayo ng false hope. Okay, you're giving false hope. Do not tell them that it's not masakit. Di ba? Other nurses narinig ko, okay, they'll be telling, ay, parang kagat lang yan ng lamok. Okay, hindi yan masakit. Okay, hindi yan masakit. No, you have to tell them, okay, masakit siya, pero ang tusok lang. Okay, ang tusok lang. Pero pag nandiyan na, hindi na masakit. Okay? Bakit? Kasi, paminsan, okay, pag sinabi mong hindi masakit, tapos nasaktan sila, okay, hindi nila in-anticipate na masakit pala ang IV insertion, okay, kayo pa ang masama, di ba? Sabi nga ni Bobby sa 'di ba, sa ano nga yung kay Bea Alonso, 'di ba? Bakit ako ang may kasalanan? Bakit ako? 'Di ba? Ano na naman ginawa mo? Nag-insert lang naman ako ng line, ma'am. O, 'di ba? Pero nagalit pa sa'yo. So you try not to tell them na it's not masakit. Tell them, yes, it's masakit. Okay? But I'll try to be in as much considerate or I'll try to insert the line, okay, at the most comfortable way na hindi ka masyadong masaktan. Just, diba? So, of course, we have to select the vein and dilate the vein. So, that's why, actually, kung sa face-to-face tayo, we will be actually, we will be showing you also on how do we assess the vein and how do we dilate the vein. So, if you have mga tourniquet dyan, you can you can attach the tourniquet to your patient at least mga 2 to 15 cm, okay? 6 to 8 inches, okay, sa area ng IV site mo. Okay? Para lang enough lang na para makadilate ng vein. Ang purpose ng tourniquet is para lumabas na ang vein. But, okay, there are certain cases that we cannot use tourniquet anymore because protruding na masyado ang veins ng patient. Okay? So, in that cases, pag protruding na ang veins ng patient, kayang-kaya mo nang insertan ng line yan, then do that. Okay? We only use tourniquet, okay, only if we cannot feel, okay, the vein itself. Okay? So, ganito lang, guys. When we do also assessment or checking for the availability of the veins, we also get two, okay, hindi lang yung tipong nakikita mo lang na, uy, may nakikita akong color green. Okay, that's it na. Yan na talaga ang line ko. No, it's not. Okay? You also need to feel. Okay? Ito ba talaga? There are veins na deceiving masyado. Akala mo veins na. Pero yun pala, hindi. Okay? So, madaming namamatay sa mga maling akala. Okay? Madaming nasasaktan sa mga maling akala. Akala mo kayo. Yun pala, hindi. Diba? So, same lang also with our veins. Okay? So, akala mo, nakikita mo na siya. Okay? Pero pag tusok mo, wala pala. Okay? Nga. Gibiyaan ka ng veins. And to tell you frankly, guys, when we cannot insert the line, okay, it's not because we are not skillful. It's on the vein. Do you believe in that? Okay? It's on the vein. Kasalanan ni vein, bakit hindi tayo naka-insert ng maayos? Okay? Do you believe in that? Ma'am, hindi namin alam, ma'am, kasi hindi pa namin natatry. Okay? But that's the reality in there. Okay? Pag hindi pangit talaga ang veins ng patient, okay, and nagtusok tayo din, hindi tayo nakashoot, okay, it's okay. Okay, it's okay. Nasa vein yan. Si vein ang may kasalanan, hindi sa skills natin, nurses. Okay? So, ayan. Then, of course, another way also to dilate the veins ng ating patient, we can make use of the gravity. Ibig sabihin, mas better kung ang position ng kamay mo is nasa baba ng heart ng patient mo rather than mag-insert ka na sa taas. Kasi kaya hindi mo paminsan walang makikitang veins for that matter. Okay? So you also have yung nakikita nyo, ano ba mga other techniques? Yung paminsan pinapakumo ang kamay. Okay? Fist clenching. Can you kumo the kamay ano tayo? Konyo na tayo. Sir, can you please kumo your kamay? Just. Okay. Okay. Example lang. Okay. So we allow them to do the fist clenching to be able, okay, to visualize the veins of your patient. Okay. Then we also have tapping of the vein. Okay? You still remember that one? Yung nakikita nyo sa mga pag-assist nyo, we do the tapping. Okay, tapping. Tapping lang ha, hindi slapping. Iba si slapping. Slapping, pinapalo mo ang patient. Tapping, you only tap, okay, using your fingers para lumabas yung mga veins. Try to do that. If you have mga tourniquets in there, you tie it, okay, sa arms ninyo. But when you tie it, pwedeng half ribbon lang siya. Yung madali mo lang hilain, pag mahila mo siya, okay, madali lang tanggalin. Huwag mo na siya i-ribbon pa ha. Yung giganyan mo pa, okay, giloop mo pa, tapos tinali mo pa. So, hinila mo ngayon yan, okay, good luck na lang, okay. Pati ang IV line, tanggal, okay. So, yung half ribbon lang siya. Okay, yung we sometimes, okay, instruct them to yung tourniquet mo, yung nasa right mo, you have the right and the left. Okay, yung nasa right mo, ilalagay mo over sa left, then ipapasok mo palabas, then, peng. Ang hirap naman i-demo. But we will try to demonstrate that later sa performance natin. Okay? So, yan. Another one, pag hindi pa nakikita, pwede tayong mag-warm compress, guys. Okay, warm compress, towel na warm lang, hindi mainit ha. Okay, hindi masyadong mainit. Okay, warm lang, enough lang para mag-dilate ang vein natin. And of course, in worst case scenario namin paminsan, okay, if yung lalo na for mga dehydrated patient, those patients who are into shock already, hypovolemic shock, we often use yung mga blood pressure na cuff. 'Di ba yung may mga ano kayo, sphygmomanometer kayo. Lagyan talaga natin 'yan. Lagyan natin ng pressure. Enough lang, okay, para lumabas ang veins sa kamay ng patient natin. Enough lang to dilate the veins also. Okay. So nakikita niyo mga considerations dito. We take into account also the age of the patient, the availability of sites, the size of the catheter, the purpose of infusion, osmolarity. Osmolarity, so example nito yung mga plain NSS, okay? And the albumin or the blood even, okay? So we will try to see into consideration also yung mga ganyang bagay kasi dumidepende din sa types of fluid natin, yung IV, size of the cannula that we will be using, and even the IV site, okay? So, of course, the volume, rate, and lateral diffusion, and of course, the degree of mobility desired. Eto, how do we explain, why do we need to consider the degree of mobility? Example sa mga pediatric patient natin. If we have mga newborns, okay, ganahan po ni mag-insert ng line sa ating mga paa ng mga baby natin. Okay, but, okay, ganahan ba ang mga adult patient na tusukan sila doon sa paa nila? Hindi, 'di ba? Okay? Kaya naglalakad naman good. Okay? Naglalakad na sila. So it's not okay na you insert an IV doon sa paa ng 28 years old. Okay? So applicable lang only siya with mga newborns. Okay? Newborns, infant, okay? Ang ruling pagani namin, guys, if toddler, okay, once marunong na yan maglakad, we do not insert an IV line anymore sa mga paa nila. Unless last resort na talaga, wala na talaga kaming namahanap sa kamay, that's the time we will insert yan sa mga toddlers. Pero, hindi mo yan pwedeng gawin sa mga sa mga adult natin. So, we also have to consider again the degree of mobility on that part. Lapit na. Okay. Again, yan. I will not go into this one na. Okay. So, I'll introduce again, we have the peripheral veins. Alam nyo na to. Okay? Kasi nakaka-identify na kayo nito sa inyong mga nurse's notes. So, commonly, we make use of the basilic vein, the cephalic vein, ang dorsal metacarpal veins. Try nyo nga, i-search yung mga veins nyo. Look at your veins. Anong veins ang available? Di ba always nakikita nyo? Straight ba si metacarpal veins ninyo? Patingin nga ng mga veins ninyo. Okay. Anong veins ang available? Ma'am, mas maayos ang cephalic ko. Okay? So, ganito din. It also entails na you know the anatomy ng mga veins. Ibig sabihin, alam mo, lahat ng tao may metacarpal veins. Lahat ng tao may cephalic veins. Okay. So, ito din yung mga cases na when we try to insert a patient na maitim, okay, darker complexion. Black in complexion, good. Okay, pwede na. Black in complexion, darker in complexion. Paano natin malaman? Okay, so you have to put it in mind na may metacarpal lahat ng patient, may metacarpal veins, may cephalic vein. So, yan lang ang hahanapin mo, yan lang ang i-feel mo. Ito na yung paminsan na tinatawag naming blind shot because we cannot see the veins pero nafe-feel namin. Okay? Nafe-feel ninyo. Okay, kahit ngayon, okay, ma'am, sino bang black sa atin? Sino bang black sa inyo? Diba? Ma'am, lisod po. Okay. You try to feel your veins also. So, nakikita nyo na yung veins nyo. Okay? Nakikita nyo, dapat na-feel nyo din si veins. Sa akin to. Sorry. Na-time bomb ko. Time bomb ba yun? Okay, sorry. So, ayan. So, ayan ang ating mga veins. Alam ko, memorize nyo na yan. Let's see. Ito naman yung mga type of gauge needles that we use, okay? So commonly, if we have mga adult patients sa hospital, we make use of the 20, and sa mga toddlers naman, we make use of the 22, okay? Again, we make use of 18, okay, once those patient needs, okay, blood transfusion, need hydration, okay, immediate hydration, then we make use of the gauge 18. Ito po pala, one of the considerations also din pala, okay, when we had our duty sa Tagum, we are really laughing in there kasi, 'di ba? Sabi ko, nagaturo ako dito, dapat kung adult, we have to make use of the 20, gauge 20, pag pedia, we make use of gauge 22. Pero doon sa kanila guys, isang cannula lang sila meron, gauge 18 lang. So, i-take into consideration din natin ang availability ng IV cannula doon. Pero of course, you cannot make use of gauge 18 sa ating mga toddlers. Kawawa naman, 'di ba? So, pabili ka talaga doon sa labas. Yan, okay. So, yan lang. So, let me show you again. Alam ko, alam nyo na to. So, as a review, so let's have here the parts of the cannula. Okay. So we have here the lower lock plug. Ito guys ha, if you will be having your duty sa mga government hospitals, okay, etong si lower lock, paminsan yan ang ginagamit nilang as hep lock. Do you remember hep lock? Ano ang hep lock guys? Sige nga. Ano ang hep lock? Patingin nga ng mga beautiful faces dyan. Si Miss Ocampo, ano yung hep lock? Do you know? Sino may alam? Anong kulay sa haplak?
Yellow po, ma'am.
Yellow, tama, Miss Ocampo. So, color yellow, yun ang ginagamit natin, di ba? So, sa mga private, yellow talaga ginagamit natin. Pero pag walang haplak, etong lower lock plug, yan ang ginagamit namin as haplak na lang. Okay? And of course, part ng ating cannula, we have the flashback chamber. Diyan natin titingnan ngayon kung may blood na ba yan o wala. The needle grip is where you hold, okay, your cannula. You have the lower connector. Si lower connector naman, this is the connector sa IV cannula mo to the macroset or the microset. Then we have the injection port cap. You can give medication in here. The wings that will support the needle, the cannula, the valve, the bushing, the catheter, and of course, the needle. Ito, there are mga questions paminsan na tinatanong ng patient. Okay, tapos na mag-IV insertion si nurse, sasabihin nila, may needle pa ba yan, ma'am? May needle pa ba daw ang cannula na nag-i-insertan mo? What's your answer? Ha?
Wala na
Ano
po,
na yan?
ma'am.
Si sure na tayo. Okay. Yes or no? Okay. Wala na. Okay, kasi ang natitira na lang is yung cannula na
mami?
lang. So, wala nang needle. Si needle is, for the purpose ng talaga ni needle doon, is punctured. But mind you guys, kita nyo yung sa history kanina, yung story sa video, when they do insert a butterfly cannula pa, needle pa talaga yun ang gamit doon. Kaya prone to infection siya, prone din siya na madali ma-out ang mga veins natin because of that. Kaya tinanggal nila yung practices na yon, they make use of the cannula na lang. Okay? Ang important lang with this one, when you remove an IV cannula, make sure na buo pa ang cannula. Okay? Yung catheter. Okay? When you remove it. Kasi there are tendency, pag may naiwan doon, this may cause also embolism shock or thrombus, okay, sa patient natin. So that can be also part ng ating complications. Again, showing you the peripheral catheters, gauge 18. We have 14. Pero so far sa aking nursing career, wala pa akong nakakita ng gauge 14. Okay? 16 kasi ginagamit for thoracentesis, okay? Spinal bloodletting, yes, bloodletting, yan. Then we also have the mga green, commonly for mga blood transfusion. All patients na for OR, green talaga yan sila. All patients that needs hydration, green din talaga ginagamit natin. So that is gauge 18. That's the bigger veins that you can use, okay? Then we also have the 20, the usual na ginagamit natin for an adult. Then,
Tapos sabi,
14
butang ko
for
sa
mga
Gcash yung 200. Asa na ko ipadala ang
teenagers,
200 na Gcash?
school age natin ng mga patient, okay? Siguro, at least, we also have to check into the build ng mga patient natin. Kasi merong mga 8 years old, 9 years old na mukhang teenagers na. Okay? So, we also have to rely on that kung anong gagamitin natin na veins, na cannula. Okay? So, of course, we have the 22 and of course, BTS, okay, ang mga infant natin, violet na ba? Purple na purple, okay, ang ginagamit nating kulay for this one. Okay. Sam, then we have to put on the gloves, prepare the site natin. In preparing the site, later on, I'll be showing you, we usually clean it. Ideally talaga guys, ideally, we make use of chlorhexidine. Chlorhexidine talaga ang ideal. Pero, hindi man kasi siya all the way available. So, what we do, we make use of alcohol. Alcohol swab ang ginagamit natin. Okay? Later on, I'll be showing you an IV pack from the San Pedro Hospital. Meron talaga siyang available doon na betadine or povidone iodine. Okay? Maganda, ideally talaga, if you really want to have a septic technique, dati meron akong surgeon na doktor na sa hospital. Pag nag-IV talaga siya, guys, dapat ano talaga, povidone ion talaga ang site. Okay? Ang ganda actually. That means that is very safe masyado. Okay. But, okay, the problem is, madumi man siya tingnan. Okay? Kaya a lot of nurses, a lot of us are not using povidone ion. Instead, we just make use of the alcohol for that. Okay? Para hindi hugaw tingnan ang mga IV site natin. So, when we try to insert the cannula ngayon, kita na natin, after preparing the site, we do the 2 to 3 inches. Ito per manual, 2 to 3 inches for 20 seconds ang cleaning ng site mo. Okay? Per manual yan. Pero the moment, kasi meron din more than 20 seconds, guys. Bakit? Ganito, dark complexion. Pag alcoholize mo, yun lang ang maputi na area. Do you get it? Kung gaano siya kadumi. Okay. So, you also have to take into consideration in that. Tingnan mo din kung, sabi di mo hanggang 20 seconds lang, pero nakakita mo lumilinis at lumilinis pa din, sige lang, linisin mo lang. Okay? You can throw it, then you can have it 2 to 3 times kung gusto mo para mas maging malinis talaga ang site. Okay? Then, when we try to insert the catheter, we have to angle it nasa 15 to 30 degrees. Okay? 'Di ba? 30 degrees. Enough lang para makapuncture ng vein. But make sure, pag nag-puncture ka, make sure nakikita mo ang veins. Hindi yung puncture ka lang. Wala ka naman nakikitang veins. Yung tipong feeling ko, this is my first time to insert. Okay? Tusok lang agad. Tapos wala naman ang tinutusok na veins doon. Okay? Katawa lang. Okay? So, let's not do that. Okay? So, the moment that there is already the blood, okay, makita mo na doon sa ating chamber, okay, remove it konti, then ipasok na all the way. Okay? So that's when we do the anchoring already. So the anchoring, meron pa tayong tinatawag na 2 types of anchoring. Okay? Actually, madaming types of anchoring also. Yung usually that we use yung H type, okay? Or H ba? H, diba? H type na ganyan. And later on, I'll be showing you mga ways natin also on how to anchor the IV ng patient natin. Then, of course, we have to stabilize by anchoring it. So, other hospital, they really make use of a OS. May nilalagay talaga sila ng OS sa site ng patient natin. Okay? Lalo na, if you later on makikita mo sa isang set ng IV set ng San Pedro, meron talaga silang OS na nandoon. Okay? So, yun ang nilalagay natin sa IV ng patient natin. This, of course, you have to take note na when you do insert an IV line, this is already an open, okay, port of entry. Okay? Then, of course, we label the site and dispose the equipment. 40 na. 41. Then, of course, we have to educate the patient na kailangan hindi magalaw-galaw, lalo na sa mga bata. Calculate the drip, your favorite thing to do. And, of course, your document. So, commonly, we have to label our IV bottle. And, of course, we have to record ang ating intravenous. So, this is an example. For today, we have plain NSS, 1 liter. Kung if there is an incorporation, plus 40 mg KCl at 11 a.m. times 120 cc per hour. Then, of course, your signature. Nawala ng signature ko dito. Okay? So, that's it. That is how, of course, you regulate your flow rate. You have your calculations in there. And of course, alam niyo na kung paano mag-discontinue. 'Di ba? Okay, you make use of the alcohols, okay, alcohol swab. You remove it one by one, then dapat lang talaga you have to press the IV site before you remove the cannula para hindi sumirit ang dugo. Okay? So, you just have to record your patient's response, time kung kailan ka nag-discontinue. Okay? So, I think we will be going with the live insertion na ng IV natin. Okay? Wait. I'll off the cam muna. Ready na?
Ay mag-continue kasi inaayos pa nila no ng ating tech team. Just a reminder for everyone, you are being monitored. Okay? So naga-screenshot kami sa inyo from time to time for your attendance. So kung sige mo off cam or naga-out mo sa inyong Zoom, then basically it is recorded and it is being monitored. Okay? So nakita namin kanina na maraming nag-alisan no sa Zoom. Okay, so tas nag-off cam lang ang speaker, nag-off cam na pud mo unahay. Okay, so na just a reminder lang gyud na you are being monitored. All right, so thank you.
Okay, we're back, guys. So, again, sabi ko nga sa inyo kanina, we will be doing the live insertion ng ating IV. So, again, we have here mga materials. Sabi nyo kanina, we have to prepare the equipment first before we start an IV line. So, ito ang mga sample ng mga IV fluids that we use. Ito, D5NSS, okay? Ang green, anong this green NSS line that we use, okay, with ating mga patient. We also have mga D5 water. So you really have to check into the label of your IV fluids, okay? And you also need to see the amount of the fluids na gagamitin natin. Again, you have to check that in your physician's order. And of course, si blood transfusion is also part of your IV therapy, okay? So again, I bet you have learned that from your fluid and electrolytes concept, okay? We make use of also blood transfusion as part of. Then, of course, ang pinakasikat also, D5LR is present in here. Then, we have our different IV cannulas. Yan. So, we have the gauge 18, the gauge 20. We also have the gauge 22. We have the gauge 24. And of course, the gauge 26. Okay. Then, don't forget your different sets of infusion sets. So we have the macro sets and the micro sets. It's very important when you start an IV line with your patient, you have to see, okay, kung ano ba yung doctor sa inyo. If it entails, okay, more than 100 drop, okay, cc per hour, then it means, okay, you will be making use of a bigger drops or make use of the macro drops. Okay. Pag mga maliliit lang, you can make use of the micro drops also. But also, one thing to consider also is the drop factor of the set that you are using. So for example, with this one, there are sets na nasa 15 lang ang kanyang drop factor. Okay. And there are also sets that utilize the 20 drop factor. So for example, the San Pedro, they have here less. Okay. Needleless, okay, set. So here we have here needleless set. So tingnan mo ang label to see what is the drop factor of your IV. Okay, dito, this one. The drop factor 1 ml is equals to 20 drops. So 20 drop factor ang pinag-uusapan niya. Then we also have, ito naman, ito 60 drops kasi these are common for ating microset. Then the other one, ito 20 drops din siya. So you have to check lang talaga ang drop factor para you know on how to calculate your drops per minute. Okay? Then of course, ito ang tinatawag nating tegaderm film. This one. Ito na mga high-tech na film that we use. Okay. Dati dala, puro plaster ang nakikita. Right now, we have mga plaster that are transparent. Okay. The advantage of having a tegaderm na film is that you can easily see if your IV site is already swollen or in color na ba. Okay. So madali mo nang ma-assess ang mga IV site natin because of this one. Okay? And of course, the usual na ginagamit natin plaster, ito yung tinatanong ko sa inyo kanina, the Heplock. Okay? So yan, we make use of that. And of course, ang walang kamatayang alcohol swabs. Okay, we make use of that. Of course, kung walang alcohol swab, we use cotton balls with alcohol. Okay, yun lang. Kung poor tayo, poor talaga, okay. Pag medyo rich, may kaya na tayo konti, we make use of the alcohol swabs na. Then, of course, ang ating tourniquet. So, ito na yung sinasabi ko sa inyong IV start. Okay. So, this is an IV start pack. When you open this one, ano ang mga laman ng IV start pack natin? So, we have a tourniquet. Individualized ng tourniquet nila. Okay? We have, may sariling plaster din sila. May sarili din silang tegaderm na film. Okay? With this one. Okay? So, you can utilize that one when we anchor now the IV sa skin ng patient natin. Ito yun. We have also our alcohol prep or ang ating alcohol swab lang yan. And of course, we have, ito yung sinasabi ko sa inyo kanina, povidone iodine. Okay? Ideally, ginagamitan talaga natin yan. But, okay, mukhang madumi ang ating IV site. That's why, hindi na nagagamit ito. And of course, we have the OS also. Nilalagay natin yan sa taas ng ating IV site. Okay? To at least control the infections ng IV site natin. Okay? So, of course, nandito din, the label. Okay? IV site talaga. So, iba ang IV tag natin, iba ang IV label natin. The IV label, per hospital protocol, like San Pedro Hospital, they follow the 36 hours. Okay? Ibig sabihin, after 3 days, you have to remove the IV site of the patient. Okay, we have to start another line para hindi magkaroon ng infection ang IV site ng patient. Again, I've been telling you, the IV site, okay, is already a portal of entry of infection. Okay, so we have to consider pwedeng magka-infect ang mga IV site natin because of that. So we have to be careful also. Continue assessment, okay, every shift, okay, and of course, trying to see also na nasa time, within the time frame pa din ng ating mga IV site. Okay? Sige. The infusion, guys. Yes. First of all, we start with, alam nyo na to, ito ang pinapagawa sa inyo. Remember, we start your IV line. So again, we have to assume that we have the doctor's order. Probably the doctor's ordered for a plain NSS 1 liter at 100 cc per hour. So again, we have to look at your IV bottle. Kung plain NSS ba yan? Ito ha, plain NSS is the same with 0.9% solution, sodium chloride. So on the other hand, baka ang doktor magsusulat lang ng PNSS. Pero since mga IV na PNSS ang nakasulat, okay? That will always be 0.9 sodium chloride. Or paminsan nagsusulat si doktor ng NaCl. Same lang yun sila, guys. Okay? Pag sinabi ng doktor sa inyo, ma'am, pakikuha plain NSS. Ito yun si Grace, okay? Ito yun siya. Wala nang iba, okay? They are utilizing other color coding, okay? So you really have to read the label of your IV bottles. And of course, if 100 cc per hour, kung adult ang patient mo, we make use of the macroset, bigger drops. Okay, pag pediatric ang patient mo, then we make use of the microsets. Okay, so again, we make use of the macroset. We will start the line now. Ay, nga na to. Mute sa inyo because been doing this one. Of course, we term this one as spiking. Open, we flip it, flip, then we insert in a twisting motion ang ating macro set, okay, or ang ating IV set. The technique one use lower. Hello? Okay. So, one technique that we use in here para hindi... Hello, hello. Okay. One technique that we use na para hindi mapasukan ng hangin ang ating mga IV set is that pwedeng i-close muna natin yung ating mga regulator. Okay, yung ating mga set. So, we close this one. And then, pag turn natin ng upside down, we have to fill the chamber halfway. Okay? Fill the half. We have to hook this one sa ating mga pole. Then that's the time you open your set. Okay? You open your set. So again, pag akyat, that is an open. That means open ang IV site natin. Then when we close it, okay, ibig sabihin off na ating close na ang ating IV line. So, one very good feature ng ating set now is that kahit hindi mo siya gi-close, moment na dumating ito sa dulo ng set natin, it eventually close na. Okay? Ibig sabihin, wala nang tumutulo dito. Okay? We have it ating mga macro set or sets that we have. Okay? So, another good feature set is that it is needleless. So the risk of having needle stick injury is mababa na kasi we are not making use of needles anymore. So if you have a syringe, you can easily attach it here, twisting motion lang, and makabigay na tayo ng gamot without any needle anymore. Again, so we have to close this one kasi bubuksan natin to mamaya when we will be inserting an IV line. Then, pwede nyo lang ilagay dito sa site lang. May mga holder din yan ng ating mga set, okay, for this one. So let's start an IV line. My patient is Ma'am Charmaine Orosio. Ay, ma'am pala. Okay. Okay lang. Kailangan ba na ng student nurse, guys? Okay. So if you are a student nurse, upo na tayo. Klaro. I have explained the procedure to Ma'am Charmaine. Okay, Ma'am Charmaine is my patient today. She's very willing to give a hand, as in literally hand, and veins niya to show you, okay, on how do we insert an IV line. So, ito na yung sinasabi ko kanina, right over left, tapos ipasok mo si right sa baba, then half ribbon lang. Okay, so later on, you just have to pull it, okay, para madali lang siya matanggal. Okay, so ayan, nakikita? Klaro? So, we'll be utilizing, para hindi naman natin saktan si Ma'am Charmaine, we'll be utilizing lang a smaller needle. So, we will be utilizing gauge 26, guys. Ay, 24 pala. Sorry. Violet pala si 26. Remember, BTS. BTS ang ating mga newborns. So, ayan. I have my assistant, si Ma'am Karen, student nurse. So, okay. So, insert now. So, if you are the assisting nurse, okay, you have to ready na plaster na. Okay? You have to ready the plaster para ready to insert na, guys. Saan ba talaga tayo? Natatawa ako. Wait lang. Ay, sorry. Live pala ako. Okay, let's insert. Kita niyo ang mga veins, guys. So, dapat you can kanina, okay, you can tap or you can flick, okay, para lang lumabas ang mga veins na. So, let's try this one. Kita nyo? Okay. So, let's start. Mag-tegaderm ako. Tusok ako, ma'am. Parang nag-go ako. Okay. You can see the blood in the chamber. Klaro ba? Can you see the backflow? Okay, pag may backflow na, ibig sabihin in na tayo. So what do? One technique para we be doing further damage doon sa mo, we often, okay, pull back the needle konti, at least mga 1 centimeter only, then push through with our, pull back natin konti, guys. Okay, then push through na konti. Okay, insert slowly. Then we have to remove the tourniquet para hindi na mag-flow ng mabilis ang ating fluid, ating dugo. What's this? Saan ko ba na ito nilalagay? Dito? Okay. So this is a label sa ating IV natin. This sa taas lang natin nilalagay. Okay? Then we make use of ating tegaderm. Para social naman tingnan, di puro plaster. Okay. Ay. Ito lang. Ganito lang to siya. Okay. So, this is the advantage of a tegaderm. Kasi, ready mo lang makikita. Okay, kung namamaga na ba yan. Okay. Is there a problem with the set ba, the IV site or what? So, madali mo lang siya makita. Then, before we remove the needle, we have to press it, okay? Sa IV site lang natin para enough lang para hindi mag-flow back ang ating IV. Yan. May backflow siya, that means in na in tayo. So we have to check into here. We have to regulate. One thing to assume that naka-in na tayo is that flowing ang ating chamber. Then we have to check into the backflow. Nag-flow siya. One thing to see also if open ang flow ng natin is that we see some backflow also sa side natin. So that means in na tayo today, guys. So again, to further secure, pwedeng gamitin natin yung mga techniques, like example, mga ganito. We can tear it halfway, then ilalagay natin sa baba. So later on, Probably if you will be having your duties sa mga particularly na rotations, makikita nyo yung mga iba't ibang technique na ginagamit ng mga nurses on how to anchor your IV. Okay. No, ito pala. Nakakat pala. Oo. So that's it. Then we can anchor it that way para hindi lang yung madaling matanggal ang ating veins also. Okay. Minsan, may mga techniques pa yan, guys. Okay. Para hindi madaling matanggal. Then, this is do it do it your own or DIY or improvise na mga splint that we use. Then, usually, ginagamitan natin ito para hindi gumalaw yung mga IV site natin, particularly sa mga pediatric patient natin. Then, we just have to anchor it with plaster. Yan. Okay, and now we're done with ating IV insertion. So, we just have to regulate now our fluids at 100 cc per hour. Then don't forget also your IV label, IVF label. Okay. Then of course, don't forget that to record in your IV, in your documentations. Nurses notes. Okay na? Mag-remove pa tayo. Mag-remove. Okay. So we're done with ating insertion, guys. So we will be doing the removing of removing of IV set natin. Sorry. So in removing, so example na mga ganito, you have also to take in consideration that there are plasters na does not necessarily need to have, okay, alcoholized, okay? Hindi dapat kailangan i-alcoholize kasi mas kung ibabasa mo siya, mas magdikit siya. So sa ganitong klaseng plaster, example, no need to alcoholize this one kasi if alcoholize natin yan, mas didikit pa siya sa skin. So we just have to remove one by one. As turo sa inyo, alam nyo na to. Okay ka lang, ma'am? Then we have our receptacle, waste receptacle lang, guys. Okay. Then don't forget to throw the used needle doon sa mga sharps natin. Okay, remove lang tayo isa-isa. Very difficult sa mga patient na hairy. Okay. Okay. So remove lang tayo isa-isa. We remove the splint first. Wala ako scissor. Ay, may scissor. May uptick ng aking assistant. Student nurse. So, ganyan kayo dapat. You have to anticipate what is needed doon sa sa procedure. Okay, we have to remove. Okay lang, hindi masakit, charm. So, kung may alcohol tayo, we can make use of alcohol para hindi masakitan si patient. But before you remove your cannula, make sure na naka-close ang inyong mga regulator. Okay? Ay, sorry. Sakit, charm. Okay. Then prepare a dry cotton balls. Ensure nyo muna, tanggal muna lahat ng mga plaster before nyo tanggalin, guys. Ha? And of course, your cotton balls. Again, press before removing. Sorry. Then, lagay na lang ng plaster, guys. Then you have to instruct your patient, ma'am, hawakan nyo po muna. Huwag nyo munang tanggalin ang kamay nyo po dito para hindi magdugo. Okay? So, we're done. Okay? Thank you, Ma'am Charm. We're done with ating IV insertion procedures. Hope you learned something from us. Okay? So, any questions? Do you have additional pa na mga procedures? Again, do not forget to document the time that you insert your line, ang IV site, Okay? Also take into consideration ano pa mga additional orders ng doktor na pwede nyong ibigay through our IV. Okay, like example, nagpa-start si doc ng IV, anong mga meds that we can give. Okay? Stat orders. Okay? So we can readily give that right away after doing the insertion. Okay? So, okay. Paano? Ano daw? Okay, when we prepare the equipment dapat bedside natin, okay, before tayo magpunta doon, ready na ang IV fluids natin, naka-spike na, okay, naka-prime na din para ready na lang ang pag-hook ng set on sa IV. May mga, so I'll giving you the, of course, there are facilities that they require to make use of the gloves. Okay? Actually, it's a very important thing that you use gloves, okay? Para it will deter, okay, hindi ka ma-infect for that matter, because there are cases that lalo na for mga HEPA patient natin, okay? Very delikado masyado yung mga ganyan. So, we really make use of gloves. But for now, for the purpose of demonstration nyo lang talaga, hindi na kami gumamit ng gloves for now. Okay. So, if you notice, if you'll be having your duty sa hospital, they are utilizing gloves. Okay. Ang ginagawa namin paminsan, ang problem kasi with gloves paminsan, mahirap namin makapa ang mga veins. So sometimes, tanggalin muna namin ang gloves, kapain muna namin ang vein. That's the time we make use of the gloves again to insert the site natin. Okay? When you remove IV, please utilize your clean gloves. Okay? So para hindi lang tayo ma-infect also to whatever infection is meron ang patient natin. Okay? Any additional? Okay. Opo. Na-mention. Okay. I think we're done with ating procedures. Hope you learned something from us, guys. Let's go back. Let's go back with our MC already. Thank you. Bye, guys.
So much, Ma'am Ames, for providing us with a detailed demonstration of IV insertion. I'm pretty sure that our students have gained a wealth of knowledge from your presentation. So, any questions with regards to the discussion of Ma'am Agujetas? Naamoy mga questions. So you may raise your hands, no? Naabay mga pangutana. Wala dyan yung mga questions. Klaro ba? Walay question. Sige daw. Please raise your hands kung may mga tanong, or you may send, mahiya kayo, pwede niyong i-chat sa amin ang mga questions ninyo. Sige, so walay mga pangutana, I believe, no, that the discussion is clear. And siguro kung naamoy mga dili pa maisip na mga questions, pwede niyo siya i-ask, no, during na lang sa ating skills lab. Okay, so since wala na yung mga pangutana, okay, allow me to present our certificates to the speakers. So allow me to read the citation. San Pedro College and Beyond Learning awards this certificate of appreciation to Mr. Raymond Manlod, RN, for his generosity in sharing his valuable time and expertise as a resource person during the intravenous therapy seminar held on August 5 at San Pedro College, Davao City. So given this 5th of August 2023 in Davao City, Philippines. Well, thank you so much, Sir Manlod.